Hello, everyone. Welcome again. We are now finally going to begin. Thank you so much for your patience. So mentioned apologies. We do have graduation ceremony going on, so it's a bit difficult coming up and down the building or the campus more generally, heavy traffic. But I'm glad to say that we're all here now and about to begin. I should start again by saying that if you haven't already got an interpreting device, please do help yourself to one. It could be checked out outside. So with this, we're a bit behind schedule, so we'll keep the introduction very short. I'm delighted to be joined by Professor Gilberto Leung, who is the other co-director of the Center for Medical Ethics and Law. So this year is special in a sense that we are taking the opportunity to organize this conference as a mark of the 10th anniversary since the founding of the Center for Medical Ethics and Law. As many of you will know, this center itself is a joint endeavor between the university's Faculty of Medicine and Faculty of Law. So here with us today, of course, are many friends. But let me first take the opportunity to thank our wonderful supporter. That would be the Wing Foundation. So without the generous support of the Wing Foundation, none of this would have been possible. So I would say that it's thanks to their vision and their leadership that it's possible to see a lot of the achievements that the center has made over the course of a decade. So with this, I hope you join me in thanking two key individuals in particular. I don't know whether Miss Anna Wu is here with us. Yes, Miss Anna Wu. Yeah, so Miss Anna Wu and Dr. Anthony Leung. Thank you so much to these two incredible individuals representing the foundation. It's again, as I mentioned, and definitely worth repeating that it's because of their vision and their leadership that we do see developments in this very important field of medical ethics and law. I'd just like to take the opportunity to thank our two deans, Dean of Medicine, Professor C.S. Lau, and Dean of Law, Professor Fu Hualing. We will hopefully get to the opportunity to interact with some our deans later on. Professor Fu, the Dean of Law, is currently on work travel, so he sends his apologies. I think he should be joining us for some of the sessions via Zoom, depending a bit on his travel schedule. But he would like to welcome everyone who's gathered here today. We are very happy to welcome with us our long-term partners from overseas. So by this, I am very delighted to welcome Kathy. Thank you so much. Who's joining us from the Center for Law, Medicine and Life Sciences at the University of Cambridge. Pete and Tanya, also from PHG Foundation at the University of Cambridge. I don't see Pete. Oh, sorry, Pete. Yeah. So welcome. And of course, Professor Yang Jolie from McGill University Center for Genomics and Policy. Thank you so much for joining us here. So our wonderful collaborators over the period of 10 years. As you know, we're taking this opportunity to link up a number of our flagship projects. Our center essentially has 4 key flagship areas to which a number of these discussions will relate. So most evidently, of course, the flagship area of clinical ethics, law and humanities led by Professor Gilberto Leung is one of the key areas, together with emerging technologies. It's a flagship area, research area that I look after. So, finally, I'd like to take this opportunity before I hand over to Professor Leung. I'd like to thank my wonderful colleagues, Miss Jane Orr, Miss Candy Ip, and Dr. Carl Klaas for helping to look into all the logistics as well as putting this program together. So my grateful thanks to my wonderful colleagues there. So with this, it's over to Professor Leung.
Just to add another dimension to what Kelvin has said, I also wear the hat of the President of the Academy of Medicine, Hong Kong, and we have an ethics committee within the academy, where we look into very similar things, many aspects of medical practice that might involve ethical and legal dimensions of things, and I'll be very happy to explore avenues of collaboration with any one of you in terms of promoting the training of our postgraduate doctors in Hong Kong, because the academy is the statutory body looking after all specialty colleges in Hong Kong. So what we do could be of significance to Hong Kong and probably the Greater Bay Area at large. So this is something I would just like to add. Other than that, I wouldn't like to defer things any further. Back to you, Kelvin. Thank you.
Thank you so much, Professor Leung. Before we start, it may be helpful, especially for participants via Zoom, to understand a little about the simultaneous interpretation feature. So we are joined by a number of our colleagues on the mainland, so they will be listening to the translation of presentations here in English. We will commence with our conference proper. I'm delighted to invite our old friend and close colleague, Dr. Katherine Littler, who is the co-unit head of the Health Ethics and Governance Unit at the World Health Organization in Geneva. So she's going to speak with us on a very exciting development in Geneva, and you'll be able to find her impressive CV in the booklet, which would be available via our website. So thank you so much, Katherine. We look forward to your thoughts.
Can you hear me clearly through the mask now? Yes. Brilliant. So I'm wearing this because I managed to pick up a nasty virus, and you won't thank me for being the super spreader here. So hence the mask. Right. A big thank you to Calvin and colleagues for the invitation. It's a pleasure to be here. I'm going to talk about some work that's just beginning. So it's a good time to get some sort of feedback on that. I've deliberately titled this framework because at this stage, we don't know whether this will be a framework or a toolkit or something else. So I'll go on to explain a bit about that. Okay, so what's going to be in my talk today? Well, I'm going to first start by giving an explanation of why we at WHO in the Health Ethics and Governance Unit, which is where I'm located, are focusing on the governance of emerging technologies. It's part of a broader portfolio of work. As you can imagine, we cover global health ethics, public health ethics, clinical ethics, and research ethics. So why emerging tech amongst all of that? Where are we in the process? In the development of this agnostic framework, the starting premises for the development of this framework, focus on ethical governance as a model. And I think this is where this framework is different from a lot of our previous tools, normative guidance that have been developed. These types of frameworks are really setting the bar. And then some of the challenges and opportunities that I see in global governance of emerging tech that I suspect will be coming out over the next 2 days. So why are we focusing on emerging tech? So I don't know how much you know about WHO, but it has these work programs, and we're currently in work program 13. We're actually planning at the moment for work program 14. And you'll see that a lot of what we're interested in this meeting over the next 2 days is critical in WHO's work program. So we've got genomics, epigenetics, gene editing, artificial intelligence, and big data. And I think if we look at the next work program, I would add quite a few things in there, like reproductive technologies, but also neuroscience and neurotechnology. Also in this work program, it says that WHO must ensure policymakers and implementers keep ethics at the heart of their decision-making, and that's where we sit. And particular importance is given to the ethical issues around these new emerging technologies. And I just want to say really that the focus at WHO with these emerging technologies and the governance and the access ethics issues is really around access and equity. Okay, so bear that in mind. That is a big starting premise for the work. So when the DG, the Director General, Dr. Tedros, formed the newly established science division, which I sit in, which was in 2018, Dr. Soumya Swaminathan, the first chief scientist, really wanted to focus on this access and equity. So where can we realize the benefits for differing populations and minimize the risk? knowing full well that at the moment, a lot of these technologies aren't accessible in a lot of regions. And that's going to take more than ethics to change it. So I want to keep that in mind as well. I think governance has a key role to play, but the frameworks that we are advocating for are not a panacea for some of the economic and new models we need to rethink in order to get emerging technology. But the governance is a key component of our change in thinking. So from 2018 onwards, we started to focus, as I said, on emerging tech. We now have 3 different types of governance frameworks in this field. One on AI, one on human genome editing, for which I was the lead person at WHO, and one on global guidance for responsible use of life sciences, which is really focused around dual use. So you can see they're encompassing very different areas. The dual use one is very broad, potentially in its application. And it is, to some extent, tech agnostic, but very much focusing on security and risk. Is that the starting point we always want to start with? That's a good question, I think. This was the last one developed. This was built upon the human genome editing framework. So people involved in the development of the human genome editing framework were also involved in the development of the life sciences. Okay, so there's some commonality in the approach and commonality in the people involved. The AI document, which was led by my colleague, Andreas Reis, was led and developed in parallel with the human genome editing, and they take slightly different approaches. One of the questions on the table that we have for going forward with the work I'm going to talk about is, when should the approaches be different and when should they be the same? So what can we standardize and what can't we standardize? And I think for emerging tech, this is a critical question, because what we're really focusing on now is the issue of convergence. The more of these governance frameworks that we produce that don't speak to the other, the more in danger we are of having governance and oversight that doesn't speak to each other. So instead of what we're trying to do is be innovative, we're actually going to slow down the process because the mechanisms and frameworks don't talk to each other. And that's why we're looking to develop an agnostic framework for emerging technology, or an agnostic tool, or as my colleague is currently calling it, a generator. I'm not sure how much uptake that's going to get. It's also worth knowing, so 2 of these, the first 2, the AI and the human genome editing, were launched in 2021, delayed by COVID. The third one was launched in September 2022. So this is behind. They're all currently in the implementation phase. The AI, as you can appreciate, has a lot of uptake because of what's happening at the moment, and there are supplementary guidances being developed with WHO technical units on different areas. The framework for human genome editing, we've had 1 implementation meeting in Uganda, a 2-day meeting using the framework as the base of a discussion on how to regulate human genome editing in Uganda. It worked really incredibly well. We used the case study in that document on sickle cell. The next step, there are some areas in which it didn't work well, and they're the lessons we're going to take through to this development of the agnostic framework. They will now use what they've learned from the 2-day meeting to develop a national action plan. So it really helped identify the gaps in governance and got the Ugandan government critically thinking about end-to-end governance, right? They want to do sickle cell gene therapy research in Uganda. They also want that research to translate into practice. How much do sickle cell gene therapies cost at the moment? Between $1 to $3 million. That is not realistic in the Ugandan context. But it's got the Ugandan government thinking about models. And I think this is a big gap that we need to think about in emerging tech, the cost. The cost is a critical issue. And this is ethics and governance have a key place to play in this. But I think part of these discussions, we need to make strong economic arguments for changing the models that we have for introducing emerging technology. So this leads us to where we are at the moment. So about 6 months ago, we started a review of these 3 frameworks with a view to thinking, how can we make them talk to each other going forward? So the idea is we are developing what I'd call an umbrella document, an umbrella framework. We're looking at the commonalities between them, the differences, what has worked in context and what hasn't. And from that, we produce an overarching document. The idea behind this overarching document is to streamline future governance, but build new generation governance frameworks. So there are some key lessons learned about these ones. These are reactive frameworks. We want to be proactive going forward. We want to standardize the processes used. Okay, so there are going to be differences between the emerging technologies. They're going to raise different risks. They're going to raise different ethical issues. But can we standardize the questions we ask? Can we standardize the values? I'm going to come back to this, or at least the shapes of frameworks so that those using them have a point of commonality. The other critical thing, and I've mentioned this already, is we want to be able to integrate the frameworks as technologies converge. So they do need to speak to each other. At the moment, it's debatable whether they speak well enough to each other. I think a big thing that we grapple with at WHO when developing guidance or models or frameworks, especially in the field of ethics, is the difference between being aspirational. You know, what is ethical often isn't what's happening in practice. So we need to be aspirational. But in order to get uptake, it has to be operationalizable. And I think this is something as a community we struggle with. So we're really trying to build into these frameworks practical tools for how you implement the values. And I'm going to come back to that. This is a key point of our work, full stop. Critically, we think of governance very broadly. We've taken the UNESCO definition. It includes norms, values, and rules. But it's not just limited to formal mechanisms. Importantly, we are focusing on our member states. We are focusing on legislation and regulation, but we're making a case that governance is an ecosystem with multi-layers of responsibility. So we'd include in that codes of practice. We'd include in that all sorts of different types of mechanisms, including research funders. We think they have a critical role to play. And the basis of our model, and this is really important because it's in all areas of our work, including the work that we did in COVID. So we did an Act A ethical governance framework. We are trying to develop frameworks that have an ethical underpinning, and we are trying to embed them across WHO in all our practices. What does that mean? Just want to show this because this is the framework approach. So if you want to know what I'm actually talking about, that we used for the human genome editing, and I think a lot of this work will be captured. So we are trying to do something that is multi-layered. It's running from the global through to the local level. It's got to be sustainable, scalable, and appropriate for use at all those levels. And it's got to work in parts of the world that traditionally have weaker regulations. So for the human genome editing work, for example, you would expect a lot more implementation of that framework in a country like Uganda than you might expect in a country like the US. So it has to be scalable and fit for purpose in different settings. Again, I want to emphasize the response on a collective response to governance. So this is both an opportunity and a challenge, and I will come back to that. So what are the key questions we are looking at in this tech-agnostic governance model? So when do you need a framework? When is it needed? We're not advocating for a framework for every type of new and emerging technology. I don't think that's feasible or scalable. There's a cost associated with these with introduction of governance. Why is it needed? Who's involved in the development and implementation? Who are the stakeholders, and at what point do you need to include them? What is included? What are the specific challenges to that technology, and what are the common challenges to governance? And how to use this, how to implement it. So how do we test that this is working? How do we implement it in different settings? How do we measure the impact? And how do we review and improve it? Very simple to say, very hard to achieve. but critically important, I think, for the success of governance frameworks going forward. As I said, there's a real focus on ethical governance going forward. And this is on the basis of what we're trying to define as good governance. We define good governance as value-based and principle-driven. It's easy to state an ethical approach. I think a lot of documents state, but it's hard to integrate it. And it's hard to often, a lot of documents don't also at the beginning identify some of the key challenges. I think one of the really good things about the AI document on the right hand of your screen, or have I got it right? Yeah, no, that's right, is they identified some of the ethical challenges. What we would then do with that, I think in the forthcoming frameworks, is really to then go about looking at the values that underpin your response to those ethical challenges. On the left-hand side, you will see the values that are in the human genome editing document. And they're divided into two categories. So we've got the values that inform how decisions are made. And then the values and principles that inform what decisions are made. And I think that line of demarcation is critically important. A lot of these will be familiar to you, but these aren't the same values that you will find in the AI document. One of the key findings of the Human Genome Editing Committee established by the DG is that while many WHO guidance documents promote a large number of ethical values and principles, they are not necessarily suitable for the global public health context, nor are they consistently used or applied across WHO guidance documents. To address the absence of a set of WHO principles that can be consistently used in WHO guidance documents, the committee recommends developing a set of WHO ethical values and principles that can be consistently applied across all WHO activities. Some of the philosophers in the room think this may not be possible. But what we are working on now, because I do think this is critical, right? We are in danger of having a proliferation of values or principles, so many that the science community doesn't know which one to respond to. And then do they start cherry picking? Right, I'm going to cherry pick this value, solidarity, because it suits me in this setting, and I'm going to ignore autonomy, right? So how do we deal with that? So at the moment, I think it's critically important that we get our house in order. We are currently reviewing the values and principles that we've used in our own documents. Starting with COVID and starting with our governance frameworks, we are going to see if the task that the committee has said we should do is possible. Can we come up with a set of values that we should be using consistently across WHO documents? Can we define them, or at least start to say how they could be applied? Any such document will have to be a living document, but I would argue if we want an ethical-based approach to governance to work, we have to be considered in the values that we use. So that's the review we're currently doing. We're also doing that across all the work we're doing on that. So we are also doing a big piece of work on climate change, health and ethics, and we are reviewing the values that are currently used in UN documents. Interestingly, there is a lot of overlap of values used, but definitions are different. But I think this is a critical component of our work if we want ethics to be taken seriously and embedded in governance going forward. As I said, we're in the first 6 months of this project. So we are reviewing the current guidance documents. We are looking at what has worked in the current guidance documents and what should be included and taken forward into our tool or framework. We will do wider consultation on the new tool or framework, and then our aim is to test it in other areas of new technology. So the first one will be neurotechnology. And the reason we're choosing that is because that is a priority for the UN Interagency on Bioethics. So UNESCO has been mandated with producing some ethical guidance for the UN. Other members like OECD, Council of Europe have some other documents. We're going to work with them and focus on implementing this governance framework in that area. We're also going to look at gene drives in innovative vector control. We're going to test it outside of, it's quite different, I think, It doesn't involve technically human subject research like of a lot of our others, but actually impact is great. And then the third and final area we are looking at is what I'm calling reproductive frontiers. But we will look at this, we will do a literature review and a scientific review for each of these areas. But particularly with reproductive frontiers, we want to understand where these frontiers will have the most impact in low and middle income countries. So I think that's really something to keep in mind. Our focus with the emerging technology is the greatest benefit to the most population and where WHO can serve the greatest need. I said I'd just touch upon some of the governance challenges and opportunities that have come up in the last 3 years of working in this space. It goes without saying that, I mean, one of the criticisms of governance has been that it hasn't kept pace with regulation. I mean, it hasn't kept pace with the tech. So I think there's been a few schools of thought with that. There's a new one emerging that, well, maybe the tech should slow down. Maybe we should be asking, is the tech the right solution? And I think that is a critical question because there's an opportunity cost. I gave you the cost of sickle cell technologies. A Ugandan government can be spending that amount per treatment on many other things. So I think we are right to question if emerging tech is always the answer. So questioning the starting premise is critically important here. That said, I think we have to approach governance the way that we have approached emerging technology, in the sense that we have to be innovative and creative. There's certainly a role for governments in the governance of emerging technology. It was argued in the Human Genome Editing report that somatic clinical trials and other types should not proceed in country without there being regulation. But where do you separate secondary first regulation and other responsibility? Regulation, by definition, will continue to move slowly. So what other mechanisms can we rely on to help the innovation continue? How can associations, funders, other players step up and take responsibility? I think this is a challenge. I think the fact that no single body has the mandate also has a challenge. Who has the legitimacy to produce guidance in this space? Who has the legitimacy to govern and the responsibility? Member states clearly have a legitimacy and responsibility, but as we know, research is a trans-border initiative. So how do we get them talking to each other? I would argue there's been a huge democratization of research and technology over the last 10 to 15 years. Maybe not enough, but it's definitely changing. And that means on all ends of the spectrum, we now have more people involved, whether they be publics, participants, or patient groups in the research design process, all the way through to the outputs. We also have people who normally sit traditionally outside institutional governance mechanisms doing research. We have the do-it-yourself hackers, biohackers, and they don't respond to normal governance mechanisms. They're not answerable to research funders. So how do we govern for them? How do we create a culture where they want to respond to the global norms or the local norms? Huge calls for fair access to new technologies. That's part of the democratization. That's also part of all the debates that are going on around decolonization. These are important debates. But again, I would reiterate, I think we need to think outside the ethics and governance box and start interacting with health economists and others. So the development of this governance mechanism going forward really does need to be more interdisciplinary if it's going to have uptake. And there's huge calls for greater inclusion in the development of governance mechanisms because context matters. We've produced an umbrella document, but its implementation in different contexts will depend on the contextual setting. I want to speak quickly, and then I think I'm out of time, to the issue of engagement in global health discourse. This is something that's really grown over the last 10, 15 years. And again, I would welcome this. But I think we should also be honest about where we are in our models of engagement. In the human genome editing work, we make a big call, the committee made a big call for what's called education, engagement, and empowerment. And it's not just education of populations, it's education of politicians, it's education of scientists. And that's not patronizing. I would argue some of people said that's a rather patronizing the education, but I think in order to engage, you have to educate first. People have to have the power to know what they're speaking about to engage on something. And then that leads to empowerment. But there's confusion between and tension between these differing things. We also are calling for engagement, but not actually clarifying how people's engagement will be used in the development of governance. And that's dangerous because that will have impacts on trust. So I think we need to be clear going forward about how we're engaging people, when we're engaging people, and how will that feed into the governance mechanism. And as a community, be honest that this is a work in progress. With the human genome editing work and with other pieces of work, there's large calls for broad societal consensus. And I think this is a really tricky concept in a polarized world. And we have a responsibility as an ethics and a social science interdisciplinary community to start teasing that out. What does that need to look like? What are the lines? Where can you proceed with the technology? Even if you don't have broad societal consensus, because are you going to achieve that? So I think there's a lot of work for us to do still, but I think this is both a challenge and an opportunity. We can't deny that there are different capabilities to take advantage of, regulate and govern. And that's where WHO really has to understand the capabilities of our member states and work with our regulatory colleagues. And I think going forward, the key for this framework will be that it's co-developed by the regulatory unit at WHO. Exploiting weaknesses in governance, otherwise called ethics dumping or shopping around. We have to be conscious of this and think of mechanisms how we can prevent this. So this is where I think this issue of standardization versus harmonization comes in, or having minimal standards, not being able to proceed unless you have regulation in certain settings. And then a big factor that's come up in, well, which was in some senses the start of the human genome editing work, was the concept of reporting concerns. How do you whistleblow? How do you tell something when something's going wrong? Because we know with that work, with the human genome editing work, that the He-Jung-Ku, that people knew what was going on, but they didn't report it. And there are many reasons why they didn't report it, but how can we create a culture where people can speak out? And I don't think it's as simple as a whistleblowing mechanism, because we know that whistleblowers often come up second best if they report on something. I would argue that we need to create spaces where the scientific community can come together. So this is a cultural shift. A lot of what we're advocating for are cultural shifts over time. But just because you need a shift and it's hard doesn't mean you shouldn't put the governance framework in place. Hence, again, my comment between a lot of what we're talking about is aspirational or cultural shift, but we have to present the community with practical models and mechanisms for achieving what we think is ethical, good governance. And I'd like to end there and thank you for your time.
Thank you so much, Dr. Littler, for that brilliant talk. It's wonderful that you started us off thinking about concerns that are shared across the world. Okay, yeah, thank you so much. I think over the course of the next few days, there will be an opportunity to engage further with Katherine, and then to also, I guess, address more head on with the question of whether we can truly be agnostic when it comes to technology. I think it's a huge question there.
Looking forward to that.
Thank you so much, Katherine. So we're going to press on. So join me again in thanking Katherine for the wonderful presentation. So I'm delighted to introduce our next speaker, Professor Xiaomei Zhai. She has been instrumental in bringing about many changes on mainland China when thinking about ethical governance of research, and that's to be broadly understood. So she's going to bring us through some of the important changes that have happened in recent years, and perhaps even more importantly, a joint statement issued by a number of government ministries. As you see from Professor Zhai's illustrious biography, she has close connections with the National Health Commission and other governmental agencies, so she speaks with a level of authority in terms of developments across the border from us. So with this, very welcome, Professor Zhai, wonderful to have you with us, and the floor is yours. So Professor Zhai will be speaking in Mandarin, so please, for those who are not otherwise familiar with Mandarin, do use the headset. I believe is that Jane channel 1 or 0? I'm sorry, I forget. Sorry about that. 1, I'm sorry. Yeah, that's right, for English. Yeah, thank you so much. Thank you. So,
谢谢，非常感谢我们港大何教授的这个邀请。刚才听到这个 Katherine 的这个报告，也特别的受启发，然后联想到我们国内就是最近有一系列的政策，我觉得真的是对我们有非常好的一个指导的一个作用。也非常高兴应邀来，我们有很多老朋友，又见到了老朋友，又结识了很多新的朋友。开文教授我们都很熟悉，很多年他在中国大陆也多次受邀给我们做很多的学术的报告。这一次呢，我们和港大又建立起来这样的一个学术的联系，我觉得非常好的一个机会。因为这回给我的这个命题作文呢，是希望我对我们最近呢，在这个中国大陆呢发布了一系列的新规。那么就是说我来跟大家分享一下我们这些一系列文件发布的一些背景和一些解读，我试着来做一些解读。好的，其实中国大陆呢，它的整个医学伦理、整个这个科研伦理的监管起步呢，是在从2000年开始比较监管的工作呢，这个开始起步。当时我们主要面临的挑战呢，是中国的研究机构的伦理审查委员会，其实比较早，在上个世纪的90年代中期就开始成立，主要的动力呢就是国际合作，比如说和美国 NIH 的合作，和英国的这个合作，很多这样的国际合作是有要求的。那么主要的职责呢是审查国际合作的项目，那么不审查，当时还没有审查国内涉及人的这个受试者的研究的项目。理由呢就是说当时国内并没有一个统一的要求和规范，所以在中国呢生命伦理学的学者就把这种现象呢批评为说道德的双重标准。所以卫生部在第一届伦理委员会成立之后呢，就着手起草关于涉及人的生物医学研究的伦理审查的办法，当时是试行，在这个他就推进了伦理审查委员会的制度化建设，在2007年的时候就颁布了这部试行的办法。那么第2届的伦理专家委员会，这是卫生部的国家级卫生部的这个伦理委员会，在这个卫生部的这个伦理专家委员会的推动下呢，实际上制度化建设，伦理审查委员会的制度化建设推进是非常快的，但是呢，现实情况就是能力建设不足。那么为了了解全国的状况呢，就09年的时候委托我牵头来做了一个在全国的调研。那么调研呢，我们就发现了一系列的问题，然后呢，就第3届的伦理委员会呢，就针对存在的这些问题，开展了一些梳理、分析、论证、完善制度。所以就从15年开始呢，就对07版的这个试行的办法进行修改，在16年的时候就正式颁布。这个颁布呢，主要针对07年那个第1个版本而言呢，提高了法律层级，它成为一个部长令的形式颁布。另外明确了机构、伦理审查委员会和 PI 的这个法律的责任，修订了关于研究的定义。在第1个研究的定义的时候，是把心理行为的这样的研究呢排除在外了。那么在07年的修改版呢，在07年修改版呢，就16年的时候就把07年的这个缺陷呢就补上了。那么在细化和可操作方面呢，有比较大的修改，条款增加了1倍以上，而且推动了实施，在全国开展了广泛的培训，提高伦理审查委员会的能力建设，包括各个级别的、国家级的、省级的各种各样的形式，包括学术交流、研讨会等等。那么针对调研中的问题，比如说使命冲突的问题，这个治疗误解的这个问题，就是 therapeutic misconception 的这样的一个问题，包括预防误解的问题，还有受益风险评估的难点问题。因为受益风险评估的时候呢，规范呢总是强调受益大于风险。 那么有的时候就意味着，只要这个评估平衡，受益远远大于风险，似乎风险可以适度的提高，甚至呢就提高到一个比较可能难以接受的这样的一个境地。再一个呢，在实践中呢，有一个倾向，就是伦理审查委员会更重视程序 procedure 的问题 ，SOP 大量的 SOP， 但是呢，轻实质伦理 substantial ethical issues 讨论的就比较少，所以大家更多的是按照 SOP 亦步亦趋的去走，但是对于实质伦理学的问题呢，就理解不够。所以针对在09年的这个调研中出现的这样的一系列的问题和我们的给国家提交的研究报告，因为我在卫生部医学伦理专家委员会我做副主任 Executive Director， 所以我呢对这些问题呢，我们就提交了一个非常详尽的研究报告。针对这样的报告呢，国家卫健委呢就非常重视，卫健委的主任曾益新的副主任呢和中国医院协会的刘谦会长两个人就磋商，亲自支持指示推进，那么就成立了一个卫生部国家的这个医学伦理专家委员会的一个办公室，把它落了地，然后开始呢就针对现实中存在的那些问题进行梳理，进行完善，最后的这个成果呢就是联合起草颁布了涉及人的临床研究伦理审查委员会的建设指南。那么在这个指南里头呢，那么因为考虑到出台一个 documents 政府的一个文件的话，程序和这个过程要求都比较复杂，比较时间长。那么为了及时的解决这些问题，最后决定以建设指南的形式颁布。所以在第一版呢，在2019年19版出台，然后2020版做了修订，最新的版本呢是2023版。那么在这个建设指南里头呢，我们就试图把实质伦理学和程序伦理学的问题 combine 在一起。每当一个程序规定的时候，都对它背后的实质伦理学，就是 substantial 的这样的一些 ethical issues 的，就做一些阐述，做一些分析，所以体量就增加，比一个政府的一个 documents 那肯定体量是增加很多。那么第一部分序言基本上是叙述最基本的实质伦理学的一些伦理学的原则，第二部分呢就是一个建设指南。建设指南呢，这个就跟很多的 SOP 呢有一些交叉雷同的地方。那么我这个特别重要的是呢，我们在第9章把术语做了一个 definition， 就是刚才这个 WHO 这个 Littler 呢这个 professor 他也提出这个问题，有的时候在不同的文件中这个定义是不同的，甚至就不再进行定义，但是大家的理解是有区别的，在不同的场景解释也是不同的，这个呢就带来了一些实施上的困难以及一些争论的无效性。所以呢，我们在这个指南里头呢，把术语全部都拎出来，做了非常明确的定义。当然，把利益冲突呢作为一个比较重要的问题提出来。第3部分呢，就是一个负责的部分。这个负责从今天来看呢，这个 list 会不断的加长。是药物和器械的临床试验这个地方呢是归药监局管，这个传统中管理监管是比较严格的，而且它的程序是非常清晰的。但是在临床研究中，除了药物和临床器械的临床试验之外，有很多跟遗传学研究有关的、生殖医学研究有关的这些研究，它有很多特殊的规定性。比如说遗传学，我们说遗传基因呢，它是个人的 permanent 非常个人的，而且它是这个 personal 的 permanent， 而且它是 powerful 的，我们都知道。而且在临床中，有的时候它是先证者发现的，就是prevent 他先发现，但是它实际上是跟家族的遗传信息是相关的，所以在他来做研究领域的时候呢，它其实有很多特殊的问题。那么生殖医学呢，更是有代际之间的问题，所以后代的研究呢都是被决定，他的出生都是被决定的。那么在这个中间呢，各方的利益是交织在一起的，父母的利益。孩子的利益，可能未来家庭的利益等等，这些利益呢，有可能是一致的，在大多数情况下，有可能有冲突的。那么有冲突的时候，谁的利益应该是 priority 应该优先考虑的，等等，它有很多特殊性。还有精神医学，精神医学也知道，我们在临床研究中特别强调知情同意，强调自我的决定自主性。但是如果有精神障碍的受试者参与研究的时候，他的自主的同意是受限制的。那么在这种情况下，应该有一些特殊的 规定，所以在精神医学的临床研究中又有了一些特殊的审查规定。还有就是公共卫生领域，就刚才那个Katherine 也提到了，其实有的时候临床研究的一些规范到公共卫生领域不一定特别适用，因为我们说临床的研究呢，通常是我们说 individual patient based 的，但是到了公共卫生领域 population based 有一些另外的公共利益等等，所以怎么平衡它？那么因此在负责4专门规定了公共卫生领域的研究的伦理审查，都是实质伦理学加程序伦理学的要求。第5呢，负责5呢讨论了中医药 TCM 它的临床研究，这个呢在讨论的时候也有一些争论，因为有些西医的这个医学界的研究认为呢，那我们现在话语下讨论的情景下讨论的是西医传统的这个中医呢没有在我们考虑中，因为2种医学的医理是不一样的，所以很难用这个西医的实证科学的办法来衡量传统医学的这样的一个研究。但是更多的专家呢一致认为，在我们现在的就包括综合性的西医为主的医院里头，其实也有大量的中医的研究在进行。因此呢，根据 WHO 的关于这个指南呢，我们请很多中医的专家和西医专家在一起出台了这样的一个伦理审查的要求。负责6就讨论了干细胞临床研究，干细胞临床研究其实一直是个热点问题。我们这个在负责6里头讨论干细胞，其实是作为 emerging technology 的一个代表，相当于一个代表，因为这一块进展很快 ，CAR T、细胞治疗、免疫疗法很快都越来越多了。那么在干细胞的伦理审查的指南的时候呢，就相对把一些最基本的伦理学的原则和一些操作上的 procedure 呢给它确定下来。第7呢讨论了人体器官移植应用与研究的伦理审查。很多专家认为人体器官移植实际上已经成为一个 routine practice， 面临的研究的新问题并不多，但是更多专家认为其实还是有，尤其最近我们这个 xenotransplantation 我们的异种移植，那么也有一些专家呼吁早期的临床试验是不是我们也可以开始，实际上是很多挑战我们面临着。负责8我把它标黄了，实际上负责8呢是2020版呢新增的，主要是针对疫情爆发时期相关医学研究伦理审查。因为在疫情爆发的时候，我们面临的挑战非常多，一个是医疗资源争医疗资源的问题，在现场那么临床治疗是优先要考虑的，但是大量的医疗团队也进来了，那么在这种情况下形成非常多的张力，在这种情况下我们及时提出来，那么及时给国家提出一些需要关注的点，所以要遏制大量的不太相关的研究争夺医疗资源的问题。所以后来紧接着我们在20年的时候出台了，就修订了新增了疫情爆发时期相关医学研究的伦理审查。在这个03年的时候，2023年的时候又做了修订主要是针对 WHO 来临床的这个新冠疫苗临床试验所提出的建议，他们对我们的这个指南呢是非常高度认可的，但是呢要求我们把72小时放进去。我们在2020版没把72小时放进去的时候呢，我们有一个考量，专家讨论的时候觉得说我们叫 as early as possible， as soon as possible， 就说不要给它确定时间，担心呢72小时定了，那么可能71小时才完成，我们需要尽早在情况允许的情况下。但是呢，世界卫生组织根据世界卫生组织这个专家核查的时候的建议，要把它定就不能超过72小时，所以这是2023版根据这个意见我们做了一个修订。那么但是我们今天这是在医学领域里一直在进展新的规范、新的指南新的包括部长令一直在 follow up。但是我们又面临一个新的挑战，特别是我们的基因编辑生殖系基因编辑婴儿，那么他把这个问题实际上就提到了我们的议事程上来。我们看到今天强大的新兴的这个科学技术和发展呢，有高度的渗透性和融合性的特点。所以刚才我听到这个 Katherine 也提到了，就是说实际上你中有我，我中有你，如果部门之间的孤岛的来规范的时候，会有漏洞，非常多的漏洞，有可能不一致，有可能监管困难是一定存在的。所以在这种情况下呢，它的新技术的这个应用前景呢，实际上提出了非常重要的伦理学问题。大家说不仅仅是 L 系的问题，包括 Cell 系的问题，包括科学上的问题。那么如何能够做到无缝衔接，把漏洞尽量 补上，因为还有监管的问题，因为各个部门分别来监管的时候，我监管你部门，你监管我部门，很难做到。所以就是要怎么样形成一个全覆盖的伦理治理体系，实际上长期以来生命伦理学的专家学者一直在呼吁，但是呢一直没有得到高度的重视。经边际婴儿这个事件呢提供了一个非常好的契机，所以这个制度建设政策的这个尽快的出台呢，所以就很快的提到议事程上来。所以这个案例呢，实际上推进了我们的制度化的建设。所以我们看到，这是2018年年底11月底的时候发生的这个案例，在香港的这个会议上，我们看到国际的这个峰会发生的这个事情，在4年的4月份，在习近平主席呢他的一个亲自主持的一个会议上呢，就通过了关于组建全覆盖的国家科技伦理委员会的这样的一个计划就通过了。所以这实际上是一个非常好的一个决策和一个里程碑式的事情。那么第一届呢到现在已经完成了它的很多的工作了，在今年呢又开始有了一个重组，这个国家科技伦理委员会重组主要是归属和职能有一点改变。现在的归属呢，归属为中央科技委管理，实际上它的对它的要求是更高了，对中国政府的重大的 emerging technology 这个政策的决策，它需要发挥更多的作用。那么它很明确，它是一个学术性的专业性的这样的一个决策的一个咨询机构，为国家的科技决策要提供伦理治理的研究报告和决策的建议。这个是在今年刚刚把它确定下来。在这个第一届的国家科技伦理委员会呢，那么我们首先发布的是一个关于加强科技伦理治理的一个意见，第一台一个政策性的一个文件，在去年的3月份。那么这个是呢，就是当然是委托我来在对现场呢做一个有关伦理学伦理准则的这样的一个解读，因为是有一个记者的会。那么在这个意见里头呢，就非常明确的提出了科技伦理治理的原则。那么把这个原则呢作为科技人员应该严格恪守的一个价值的理念和行为的规范，而且呢，他特别提出它是我们人类科学共同体共同遵守的准则，这个没有区别，因为是从 human being 和整个我们科技共同体出发，提出了5项原则，这个跟国际科学共同体共同认可的原则是高度一致的。那么说这是我们跟国际科技共同体对话的一个基础，有一个共同对话的语境，所以对推动国际合作呢也是十分必要的。那么这个原则呢，大家可能也都清楚，因为都发表了很长时间了。第一个呢，增进人类福祉，这就是说科技向善 scientific science for good， 就是 science and technology for good， 就是这是一定是增进人类的福祉，这是原动力。科技发展的原动力，所谓初心就是这个问题，而且它的目标是捍卫科学共同体沿着向善的轨道来发展，从价值判断的维度来保障科技发展的方向，确保呢科技真正以人为本，促进社会的和平和可持续的发展。那么第二个原则呢是尊重生命的权利，这个尊重生命的权利呢，就是这个谈到的原文呢，我们谈到的是人格权，这个主要是跟新近颁布的这个民法典使用的术语是一致的。另外呢，就也谈到了实验动物的3·2原则。很多人说呢，怎么尊重动物的生命的权利，实际上是赋予了我们研究人员善待动物的义务。公平公正的原则，这个也是强调了要尊重不同的宗教信仰，承认不同的道德共同体在文化和传统方面的差异。那么公平公正的包容的对待不同社会的群体，防止歧视，防止偏见。那么当然在研究中，对待受试者还应该考虑就是这个受试者的选择，这个受益和负担的公平等等。那么也讨论了也讨论了科研成果享用的公平公正。那么就强调新的技术的部署和使用不应该仅仅由市场来决定，特别是在医疗领域，国家和国家之间的合作要优于对市场的考虑。我们要确保公众对新技术的可及和可负担性。第4个原则呢是合理的控制风险。 合理控制风险的原则呢，就强调 emerging technology 呢，它会使社会面临着更多的风险。那么这些风险有很可能不仅是对人的风险，对社会机构的风险，也可能是对人类的风险，而且这些风险有可能是 uncertainty， 马上有一些不确定的。那么在这个时候呢，我们怎么来对待它？另外呢，技术的安全性给我们的风险是什么？那么社会和公众基于道德信念分歧带来的问题是什么？如何区分之？都做了一些阐述。那么怎么控制这些风险？那么怎么来审慎的、全面的思考现代前沿这个生物技术的功能？另外呢，就提出要有一定的前瞻性，要负责任和审慎的立场对待新的技术。尤其是对我们人类自身、人类社会存在可能产生重大影响的、极具争议的技术的广泛应用的时候，更应该是这样的。那么原则5呢，公开透明，说现代科学技术呢具有广泛的渗透性，与社会公众都是息息相关。我们所有的公众都是新技术的一个践行者，实际上，所以呢，信息的披露的机制，确保公众的知情权。促进公众和所有的stakeholders 里有关方的广泛的参与是十分必要的。这个呢是说对科学技术的健康发展，公众呢对科学技术的理解和信任呢都是十分重要的。那么当时呢，我们在讨论这个公开透明的时候呢，也谈到，就是说它的目的并不一定着眼于对问题要达到一个高度的一致性，而是着眼于 stakeholders 从不同的视角、不同的方式来讨论问题，来更好的理解那些基于和自己意见不同的而制定的那个公共政策。这样的话，其实就能够更好的理解它，促进了公众对公共政策的接受度。另外呢，公开透明也意味着要加强在科学界、伦理学界、决策部门和公众之间对这一类研究活动的社会环境和伦理含义的对话和讨论，也同时呢，也意味着要加强与国际同行之间的合作和对话。那么当然也谈到了这个规范性的伦理治理。那么今天呢，新兴科学技术呢研发和应用呢，特别是像neuroscience 这些，包括脑控技术和控脑技术、基因编辑技术、合成生物、异种嵌合 AI 技术、异种移植等等，它的研究和临床转化，实际上这种新的更为复杂的伦理问题是不断的呈现的。那么它也提出了我们新的伦理问题的责任的问题。那么这个规范性治理呢，它的责任是负责任的研究和创新的支柱，因此呢，探寻在伦理问题发生之际或者是之前就应该去应对，就是要有前瞻性和预判性，而不要等到问题发生以后再按传统的既定的方针去预定，就人们形容它不要亡羊补牢或者叫马后炮的形式。为此呢，2023年9月这个科技部发布了新规，在程序上进一步强调科技活动的合规性。是不是时间？尽量加快。那么这是这个新规，今年发布的这个新规。这个新规呢，它的是发布了科技伦理审查办法。这个科技伦理审查办法是作为一个试行，就是势头有一个全覆盖。过去我们前期的工作呢，都是集中在医疗卫生领域，但是由于复杂性，由于渗透性，那么它力争全覆盖。我们看到的一个最大的一个特点呢，我简单的梳理一下，因为时间关系，就是在它的定义活动的时候呢，把哪些活动应该来进行伦理审查，这个范围是大大的扩展了，这是第一。第二呢，我们说就是审查拓展了审查适用的范围，那么就是修正了在过去在医学领域里没有囊括进来的这样的一些问题。那么这是第一个特点，在新规。第二个特点呢，就是规定了审查的主体，试图就是要强调谁应该为什么负责的问题，而且规定了责任主体包含了高等院校、医疗科研机构、医疗卫生机构和企业。这个在传统的医学领域规范的时候是不会包括这些机构的。那么它也是反映了这个今天的科学技术高度的渗透性和融合性的特征。那么这个另外强调了风险的评估，大家也都知道这个风险评估是最难分析的。那么在这个审查办法里头呢，首先就规定开展科技活动首先应该进行风险评估，应该制定本单位科技 风险评估的一个办法。另外呢，审查程序做了非常清晰的界定，什么样是一般程序，什么样的程序适应简易程序，什么样的研究适应专家复核程序以及应急程序。那么复核程序呢，这个复核制度呢，主要是一些确定性太不确定的、风险太高的，那么这样的一些研究活动呢，仅仅依靠机构的伦理审查是不够的，需要有一个复核，所以建立了一个复核的清单制度。这个清单制度是一个动态的，而且内容呢也会不断的调整的，这是新的办法。那么就是这个复核制度呢，实际上是着眼于打破那个先占为主，我先干起来再说，和严密防范安全了我再说，就是这是一个刻板的二分法，而是采用一个积极谨慎分类治理的立场，这充分了考虑了前沿科技活动的风险和具有不确定性的特点。那么这是一个政策。那么作为一个力求全覆盖通用性的指导性文件，再次强调了我们的原动力，科技活动的原动力是以人为本，有利于促进社会的可持续发展，目标是通过价值判断这个维度来维护科学共同体沿着科技向善的轨迹前进，确保科技活动真正能够造福人类。非常感谢大家的耐心，谢谢时间，也谢谢我们2位同传 hard work， 谢谢。
Thank you so much. I'm afraid that's all the time we have for now. I'm very welcome to interact with our speakers during the break. We're now going to go on to the next talk. So thank you again, Professor Zhai.
谢谢，谢谢，谢谢。
I have the pleasure of introducing Katherine Littler, who actually studied in Melbourne and then Oxford and then Monash, and now she is a professor of intellectual property and medical law at Cambridge. She's going to talk to us about the important role of patent law in the regulation of emergent medical technology. Thank you.
Well, yes, thank you. Thank you very much for that kind introduction. And it's a great honor to be speaking to you at the beginning of this conference. I wanted also to thank the Wing Foundation, who has been a great supporter of our setup in Cambridge and has enabled us to collaborate with CML for many years, and we hope many more. Maybe Monash as well now, who knows? Speaking at the beginning of the conference is also a little daunting because you don't quite know how things are going to get going. And wow, we've had 2 magnificent talks about people who are really doing some practical, useful work on regulating emerging technologies. And as I was sitting and listening, I thought, gosh, my talk is really different from both of these. So perhaps I should say a couple of words just to change gears and see if I can get you to come along with me on the journey in my paper that I prepared before coming here. So you might have heard the little story about the aliens that come to Earth and they come across the elephant and they have to describe the elephant to the beings back home, and they all approach the elephant from different perspectives. And I think we've heard a little bit from 2 people who are working at the public-facing end, and they're seeing the trunk and the face and all the interesting parts of the elephant, the most interesting parts. Well, I'm about to talk to you about the kneecaps of this elephant, you know, a little specialized, but still really important for the elephant's journey. And of course, perhaps I should say the metaphor here of the elephant is the regulating emerging health technologies. Okay, so I knew that I would be at the beginning of this event when I saw the program. So I decided that although a chapter that my colleague Matteo Aboy and I are writing is quite detailed and in the weeds of some recent empirical work that we've been doing, I thought I would try and focus on some of the opening points in our chapter. The chapter has the title that you see here, but like I said, I'm going to focus mostly on some general points and shed light, I hope, on the first question of the conference, which is what is the regulatory state, who are the key actors, and what are their roles in regulating biomedical R&D. Okay, so when I was invited to this conference, I was thinking about what might be my contribution and what is the contribution I could make from the chapter that I'd like to write for the CMAILS book. And I was thinking that over my career, I've been lucky enough to work as a lawyer in many different capacities, including in legislative development, also legal practice. And now for many years, the bulk of my career has been in teaching at a law school like Calvin and several of the rest of you. And I've realized that we spend a huge amount of time teaching law students about reading case law and interpreting legislation, but so little or so much less time discussing how to design laws that work effectively as regulatory tools. And yet this is often why students want to study law, because they want to make a difference in the world and, you know, see law as a constructive a tool in the world. So I think this conference is really a super topic, Calvin, and I think my first message that I was planning on bringing was it would be great if we could do more of this as law school teachers, talking about regulation as a device and as lawyers, and bring along and nurture the next generation. But I can see the faces here, many of whom I know, and I know you're already in that domain. I thought I would share with you a reference that I found very useful when thinking about these topics. And maybe now I'm shifting into the academic gear, which might be useful for people at the practical face of the elephant. So this, if we're thinking about law as a toolbox, a regulatory toolbox, then this is one of my favorite references. It's a book by Baldwin and Cave called Understanding Regulation, Theory, Strategy and Practice. And in chapter 7 of their book, it's called Regulatory Strategies, and it's all about the regulatory toolbox. It's got a terrific summary table, table 7.1 at the end of the chapter. And the table I've put on this slide is an adaptation. I've extracted the forms of regulation that they discuss in their chapter, and they also identify strengths and weaknesses. Then I've added some examples from our field of emerging health technologies. So, for example, in this chapter, they talk about command and control, commands which prohibit and forbid certain activities that are backed up by penalties like fines and imprisonment. And this is the sort of law that people often first think about when we talk about law. They also discuss self-regulation. We heard a little bit about this. It's so different that some people doubt whether it's even law at all. It's certainly regulation, but people have come to accept it as soft law, and also the province of lawyers. Other forms of regulatory law that they discuss include laws requiring information disclosure, such as labeling drugs, principles of informed consent, laws requiring licensing and market authorization, such as the fact that laws require medical products to be authorized by government before they get put on the market, and IVF clinics to be licensed. And then there's also a great deal of law that just exists there and has done so for centuries, that governs all the various rights and duties that we have to each other as private citizens in contracts and tort, and latterly in data privacy. So I think using this kind of academic literature can be a useful organizing set of tools for those of us who are trying to do something that we see as new and original in regulating emerging health technologies, but we can reach out to people that have been doing more general academic work. Now, there is one area of law, however, that is conspicuously missing from Baldwin and Cave's excellent overview, and that's intellectual property law. And this brings me to the second message of this presentation. Intellectual property law, especially patent law, is too often regarded as a niche area of law for experts. But my point is that it needs to be seen as a form, a particularly important form of regulation and governance that's sitting alongside all the other tools that we have for regulating emerging technologies. Now, I don't know how much I need to convince you of that, but I'll just develop the point a little. So there's a variety of definitions of regulation and governance. And I'd say that patent law fits comfortably within them all. I've got a few of the definitions on this slide, and one that I like in particular is, and maybe this will come up across the course of our 3 days together, that a regulatory tool is a strategic policy by an authority, but you might define that in different ways, that aims to change the behavior of the regulated person, might be natural or legal company, to avoid various harms that result from free, unregulated interactions. Okay, so there's a definition for us, and it encompasses both direct and indirect methods of control. It also incorporates change induced by sort of deterrence and punishments, but also incentives. And it also refers to a wide range of harms, ranging from physical harms to an individual's well-being through to harms to public values, maybe human dignity. And another harm relevant to the issue I'm speaking about, which is market failure. So as I was saying, I think patent law sits well in this definition and many others. It's a way of changing the behavior of regulated persons in indirect ways, using incentives, and it looks to correct market failures. So some of the market failures that it's trying to correct, there's two really. The first one you're probably familiar with, looking at this audience, which is that it's trying to correct a free riding problem. The gist is that in a patent-free technology market, innovation is costly, imitation is cheap. So generic firms outcompete on prices. Innovators leave the market and innovation stagnates. That's the potential market failure. A second market failure is a secrecy problem. So in the patent-free technology market, innovators keep secrets, preserve economic value, but secrets slow the diffusion of technology, which means that competition stagnates. So this isn't good for consumers or other scientists. So we've got a problem of potential innovation stagnation and a second problem of potential competition stagnation. So to spur innovation, fair competition and useful diffusion, we need some sort of policy to try and correct this. And this is where intellectual property or patent law comes in. So they provide 20 years of market exclusivity in the form of a government grant of property. And during this time, up to 20 years, the patent owner has an incentive to develop and improve their invention in the emerging field. And that's because they have no competition for up to 20 years. So they want to try and capture what the market can bear. So if they can improve their product, they might capture more value. In addition, patent systems require the applicant to disclose technical details of their invention in the front part of their patent application, which is usually several pages long. This is an international requirement under the TRIPS agreement, and it's this that helps diffuse technology. So the disclosure helps diffuse, facilitate competition, helps follow on innovation. It helps achieve proportionality between the invention and the property rights. It ensures that patent examiners, judges, and other parties can get enough information to see if the patent is valid and infringed. So that's how patents actually try to tackle both of these market failures. And I think an important point for today and in the general audience is that notably patent law is very often the first legal system to have substantial contact with emerging technologies. So long before the media becomes aware of a technology, the patent system will have already received a large volume of information about the trends emerging in that sector and the companies that are making the running. So you could think of patent law as like this massive observatory for upstream technology. So I'm not the first person to press home this point about patents being a form of regulation. The literature is growing. Some of it is specific to emerging health techs. Some of it is more general in relation to innovation in general. And as this literature is growing, the viewpoints are also emerging about how various parts of the patent system work or fail to work together to make the patent system a useful regulatory device. And this brings me to my third point, and that is that there's many elements in the patent system, and they all have to work together for it to achieve its regulatory impact. So if we can look at each of the separate parts of the patent system, we can get a better grip on what might need adjustment. So Burke and Lemley's article on the patent system as policy levers is an excellent account, and they describe approximately 10 ways in which different rules in the patent system are sophisticated levers for regulation. They don't necessarily think that the patent system functions well, just like machines need tuning up and calibration, so too does the patent system. Another key point they make is that in order to do this tuning, this calibrating, we really do need empirical evidence. And one of the most important policy levers is the set of rules on patent eligibility, and this determines what is in and out of the patent system. It's like the ignition of an engine. It's like the on-off switch, you could say. So not everything ingenious is a patent eligible invention. For example, you could have a clever, ingenious detective story. It's clearly not eligible. Other non-eligible subject matter includes things that are solely discoveries of nature, solely abstract algorithms, or solely computer programs. This has been very contentious for emerging technologies like genomics, reproductive, and AI technologies. The reason for this eligibility lever, roughly speaking, is that policymakers think that patenting some things lead to more harm than good, because they might tie up too much technology that should be available for other people to use. The patent system not only stops people from using an invention if they copy, it also stops people from using an invention if they independently invent. And so we have to be careful not to put patents over things that might create more harm than good. Another key lever in the patent system is something called sufficiency of disclosure. And it's called written description and enablement in some jurisdictions like the US. It controls how much secret information must be disclosed, and it's so very relevant to the second function of patent law and diffusion. If we go to this engine metaphor, it's like the throttle controlling how much information is diffused through the patent system. And the theory is that disclosure, if it's sufficient, if the description of the invention is detailed and clear enough for a skilled person to replicate the invention. So some information may be missing or unclear in the patent, but the skilled person must be able to fill in that missing information and replicate the invention. That's how much the inventor has to put down in the patent in order for it to be a sufficient disclosure. You might be surprised to hear that the doctrine has given the courts many headaches. Patent applicants typically only want to disclose what they have to. Their patent applications are generally only approved 50% of the time. So they don't know whether they're going to get a patent for about 2 years, but the patent will be published after about 18 months. So they take a bit of a chance. So they don't want to put out more than they have to. The courts have tended to say that the disclosure is sufficient if a skilled person could replicate the invention without burden. But there's various other things that they've struggled to decide, like whether you have to disclose everything falling in your claim of property or just a subset. So our research team in Cambridge, we agree strongly with Burke and Lemley's concept of patent rules as levers. And we also agree that a lot of empirical evidence is needed. So as you can see from this table, we've done a lot of work looking at different policy levers in the patent system. And last time we were in Hong Kong, we spoke about some of the work we'd done on patent eligibility and genomics. Now, rather than repeat that material today, I've added a slide that summarizes that. Not everyone will have been here back in 2018, and I know today is about genomics, but I thought I would nevertheless speak about some of our more recent work, which has been on AI-enabled healthcare technologies. But I'm happy to take questions on the final slide and genomics if you like. So in the time remaining, I'm going to now to say a few words about where we're going with this new work. Okay, so medical AI inventions are rapidly entering medicine. The FDA has now authorized over 700 medical AI devices. Despite this rapid growth, the role of patents in this process remains relatively opaque, as it often does until people like ourselves get around to kind of studying what's going on. There is much debate. For instance, scholars like Nicholson Price, they argue that patent law is failing to provide enough incentives for medical AI. And he's particularly worried about the patent eligibility decisions in the US Supreme Court, especially the case of Alice Bank. He thinks that case is drying up the patents tap. He's also argued that it's too difficult to disclose an AI patent because so much of what happens in machine learning and neural networks is a black box. On the other hand, other commentators have argued that they're worried for very much the opposite reason, and they think that AI inventions are too easy to patent and that patent agencies are granting much too broad monopolies without insisting that patent applicants disclose enough information. So with these two contrasting opinions, this was a field where we were like keen to get our teeth into and find some empirical evidence. Right, so before I tell you what we found, let's have a little bit of audience participation, right? Let's see where your intuitions lie. So what's your intuition on these two debates? Okay, so the Alice Bank decision, it held that claims to algorithms, natural laws, and abstract inventions are not patent eligible. In order to patent, your inventive concept must have significantly more than those things. And they added that implementing an abstract or natural law on a computer is not significantly more. So this is why people like Nicholson Price were worried that post-Alice, medical AI inventions might not be patent eligible and the patents tap would dry up. So first question, do you think that post-Alice medical AI inventions are often eligible? Is the patent system still switched on? So hands up if you think yes. Hands up if you think no, Alice has been a sharp restriction. And hands up if you think, I have no idea. Okay. All right, well, at least we've established that, look, people don't know. It's really hard to get to the bottom of this just on opinion. Second question before I tell you what we found is, what of the following do you think is disclosed when a patent is granted for a medical AI invention? Okay, so you might have multiple answers for this. Do you think the AI architecture is disclosed? Hands up if you think that's what's being disclosed. Or the code listing. Okay, keep your hands up if you want to for the mathematical details and weighting. And the performance characteristics. Okay. And the training set data. A little bit. And I have no idea. Okay, a mix there. All right, well, let me show you. We have done empirical work on both these topics now. So in a paper published earlier this year, Matteo Boy and his co-authors published a landscape of the patents on AI-enabled medical devices that's looked at the patenting trends before and after the Alice case. Right, so I asked you what you thought. Most of you will honestly say, don't know, and there was a little bit either way. Well, what they found was that medical AI patent grants have been growing rapidly with an annual growth rate of nearly 40%, and will be even more depending on the pending patents, the light blue patents that are yet to be decided. So fears that patent eligibility lever had been turned off were largely unwarranted. The patent switch is still on. The allowance rate has increased from 48 to 64%, and normal is kind of 50 to 60%. So you can see that most patent attorneys are finding the process of applying for a medical AI patent quite normal. So with all this growth and the patents being there, a follow-up question was about the robustness and the quality of these patents, especially whether or not they were being sufficiently disclosed. So later this year, we did further work and looked at a large number of medical AI patents. And this is actually quite groundbreaking. People have done sort of case study analysis, but not a large number of patents at any one time. So we looked at more than 400 patents, and they've all been granted. And we looked at the 5 measures that I asked you about: the AI architectural details, the code listing, the mathematical weightings and details, performance characteristics of the AI, and training set data. And the people on the team whose job it was to read through all these patents, 400 of them, they had to grade them for each of these 5. And if there was no information, they would give it a 0. And if there was 1, they would give it a 1 for minimal mention, and they would give it a 2 for detailed mention. And we chose these 5 dimensions because these are what are typically required in bioengineering journals. So what we found was that the patent disclosures were actually really low on all 5 dimensions. So there was much less detail in these AI patents than you would get and be required to give for a peer review in a bioengineering journal. And what this means is after the patents expire, it will be quite difficult for a generic medical AI invention to enter the market at a quality level. Like, they could enter the market at a very basic type of AI invention, but they lack all this detail that would make it a quality device. So with evidence now of such low disclosures over so many AI medical inventions, we have to ask you, is this sufficient? As a regulatory device, is the patent system working? From a legal perspective, is it sufficient? It's difficult to say, because judging sufficiency on in a patent is very case specific. And the level of disclosure required by patent law is actually quite low. It was deliberately set low in order that scientists wouldn't have to do laboratory tests or clinical trials in pharmaceuticals and chemical fields. But all the patents we looked at have been granted, and the disclosure is so low on all dimensions for an AI medical invention that we do have doubts whether these patents would stand up to challenge. From a regulatory perspective, is it sufficient? Well, probably not. And we think there's a looming problem. With such low levels of disclosure, issue is that medical AI technology won't diffuse in and meet the second function of the patent system. It's going to store up problems for competition in medical AI inventions after the patents end. So we have 2 recommendations about this. First, we strongly recommend more detailed examination guidelines to prompt examiners to think about the burden of work that's still required across if multiple dimensions of the AI invention have not been disclosed. So this idea draws on what we saw in the genomics field and how the patent system adjusted to Supreme Court cases that unsettled the patent system, and they've now adapted to that. So we think that the examination guidelines helped very much in that setting, and we think they would help here. Again, you could say this is like soft law adjustment. It wouldn't require legislative reform. However, this is not likely to overcome the lack of training data being disclosed. So our second suggestion is more controversial, and we would only say it as a consideration at the moment. We wouldn't strongly recommend it. We think it's something that needs more work, and that is to consider a deposit system. And it's inspired, the idea is inspired by the deposit system for biological microorganisms that the patent system developed. So the microorganisms can only be accessed under strict conditions, but they must be deposited because it's very hard for competitors to be able to make them just based on a written description. All right, so in conclusion, I'm going to give you our 5 key messages. First, we should teach law students not only what the law is, but how to use and improve law as regulatory tools. Second, we should recognize patent law is an important tool in the regulatory toolbox. It corrects 2 market failures, or it's supposed to correct 2 market failures, free riding that chills innovation, and secrecy that hinders competition after patent exclusivity ends. Also keep in mind that it's one of the first regulatory tools that an emerging technology will meet. It has a major impact on the pace of technology and therefore its power, and also on its profitability. So it's a really important area of the toolbox. Third message is that there's more than a dozen patent-related policy levers to help calibrate the system, and these need empirical research. 2 of the most vital are patent eligibility and sufficiency of disclosure. And fourth message is that having studied hundreds of granted medical AI inventions, we see a looming problem with disclosure. And if the patent system is to remain a fit for purpose regulatory tool, we need to do something about that. And our 5th message was somewhat optimistic. We think that the disclosure issues can be improved with lessons gleaned from genomics and improving the patent examiners' guidance documents. Doesn't require legislation, and we could also consider a system for depositing AI training data. Thank you.
Thank you so much indeed, Kathy, for this very, very stimulating talk.
We're going to continue the session. Going to see, there Jan is. Okay. Another good friend of the Center for Medical Ethics and Law, as you see here. So the Center for Genomics and Policy has been a close collaborator on many projects, and we have collaborated with Jan on a number of papers under his superb leadership. As you see, Jan has got an illustrious profile, having published in many prestigious journals. So Jan, the floor is yours. Thank you so much. Welcome.
Thank you, Calvin, for making this possible. And I want to also thank the Leung Foundation for giving our little center such support for us coming often to Hong Kong and sharing and receiving people from Hong Kong as well at the center. It's really a great collaboration. Now, the presentation I'll give today is titled International and Comparative Law as Drivers for Legal Reform at the National Level, Introducing the GDO. And it's really an excuse to talk about 2 things. First of all, the Center of Genomics and Policy in Montreal and our approach to legal research and policy research, and a particular interest of mine, longstanding one, which is genetic discrimination, and a pet project called the Genetic Discrimination Observatory. So on that note, I'll start by saying a few things rapidly, because I believe a lot of you are already aware of these things. International human rights laws and comparative law are 2 disciplines that stand a little bit outside of legal training very often. It's not the kind of discipline that you hear about in your first year in a law degree. it's sometimes considered as a bit different than other legal discipline. And I will show you how using these disciplines, and that's been the approach of the Center of Genomics and Policy for many years, can actually help you having a concrete impact on positive law at the national level. So international human rights law is a body of international law designed to promote and protect human rights at the international, regional, and domestic level. It's funded on a limited number of treaties, convention, and on international customary policies and practices. So very often these are documents that are not legally binding at the national level. They're difficult to enforce and sanction, and sometimes their legitimacy is contested by some legal scholars and philosophers, but they can be extremely influential, as we will see nevertheless. And a very good example of that is the Universal Declaration on Human Rights, which is not legally binding, but has nevertheless find its way into many national laws and constitutions as well. And speaking to our next legal domain, that of comparative law, it's a discipline that's interested in comparing the law of one country to that of another. And of course, the method is to look at the concept, belief, and reason that underline law in a given country. That is the legal mind and framework of legal philosophy that help drive and structure specific law. And you have to demonstrate a good bit of humility and truly immerse yourself into sometimes radically distinct legal tradition to be successful at looking at international law. And of course, doing this has many benefits. It can help you inform national law, and we're very good at this in Canada, or bad depending on your perspective, in that we're well known for usually waiting a couple of years after a legal change has been made in the US or in the UK, and then basically importing it into our own system if we think that it works. And another use is to promote of comparative law, is to promote international harmonization of domestic laws and international law. And a good example of that is an organization of which I'm a member of called the Global Alliance for Genomics and Health, which is all about trying to develop tools and standards to harmonize data sharing practices across the world in the field of genomics. And so the Center of Genomics and Policy, as I was explaining, has an approach that is guided by both human rights and also comparative law. And when I say human rights, I'm really focusing on three particular human rights, which were really are the ones that we use to frame our approach to research, is the right to health, the right to non-discrimination, and also the right to science. I'm sorry, it says right to health twice. That's a bit of a typo. It is right to science is the third one. So I will focus for the rest of the presentation on one specific human right and how we did research and adopted tools to promote legal change. And so that's the area of genetic discrimination, or rather the human right to equality or non-discrimination. So genomics, I don't think I need to tell you that anymore, is part of 21st century medicine. It's increasingly important for healthcare and disease prevention. We just have to think about the new predictive genetic testing for breast cancer, for example, pharmacogenomics, medication, the use of genomic sequencing to study how a virus is evolving in real time and how it affects different hosts differently. And so genomic is becoming important. But there's this issue with genomics that's called genetic discrimination. And it's been defined in different ways in different publications. Generally, we can agree that it involves treating differently, negatively, or unfairly profiling an individual relative to the rest of the population on the basis of actual or presumed genetic characteristics. So it's giving a different treatment to individual on the basis of their genes. Genetic discrimination remains uncommon, meaning that it is not widespread. You're not going to hear about it every day necessarily. And the cases are limited, and they mostly involve somebody that has susceptibility genes to a monogenic severe genetic disorder. But even though it's not widespread, the anxiety about being discriminated is actually quite widespread, meaning people are worried about genetic discrimination when it comes the time for them to take a genetic test. And this makes them reluctant to participate in research or even to get tested if it is something that is indicated for their health. So genetic discrimination is also a source of legal, social, and ethical issues that are quite complex, may impact people from a psychological and physical sense as well. And it's been a long-standing issue. I mean, the first papers discussing this came out in the 1970s, and there's been significant number of laws that have been adopted, but we're still struggling with this challenge. And you see that it's also something that in international law, through, for example, instrument like UNESCO's Universal Declaration on the Human Genome and Human Rights, is something that we believe should be prohibited. And this is if you don't believe what I was saying about the fact that many different laws have been adopted across the world on genetic discrimination. This illustrates some of the work that we do at the Genetic Discrimination Observatory. It's basically a map of different policy approaches. It's not completely up to date, of course. Things change very quickly, and this picture was taken from about 6 to 12 months ago. So that's why there might still be some discrepancy about what is actually the state of the law in every country. But we keep it updated constantly on the website. So do look at the website if you're interested in this. And the point there is just that the different color simply indicate different type of normative approach to prevent genetic discrimination. So you can see that many countries have adopted a plethora of approach to address this, but that even in countries that have adopted laws, the problem remains. There is still anxiety over genetic discrimination, the risks of genetic discrimination. And in addition to that, I mean, you can explain it by many reasons. It's difficult for domestic law to constrain a challenge that's raised by science that's evolving very quickly. So you try to define what you're trying to prevent and prohibit, but that changes as genetic evolves into genomic, into proteomics, into all kinds of other epigenomics and all other disciplines like this. And also, law is usually the result of a political agenda of national legislator that is driven by a short-term opportunistic agenda. And another thing that we've noticed over the years is that having a law is insufficient. You also need to engage stakeholders on the topic. There was a study in the US that was made after the adoption of the genetic non-discrimination law there. And the result of the studies were clear that most of the people in the US had absolutely no idea there existed a protection against genetic discrimination, including physicians. The only category of people that seemed to have been aware about it were the genetic counselors. So that means that you're probably maybe missing the target with your law at that point. Of course, genomic data is uniquely identifiable, meaning that privacy in itself is not sufficient to protect individual all the time because it's impossible to perfectly protect genomic data. As soon as it's out there on the net that you're sharing it, there is a possibility of linking it and therefore of identifying someone. And so there's a need for national approach to be complemented by the collaborative work of a human rights-driven international network. That was the idea behind the Genetic Discrimination Observatory. And so I launched the GDO at the international level in 2020. It was basically intended to be a network of researchers and stakeholders dedicated to researching and preventing genetic discrimination worldwide. And we have an ongoing collaboration with the Global Alliance for Genomics and Health. And the idea is with them, we develop international standards that are intended to prevent genetic discrimination. And as I mentioned, the working model, we're funded in the human rights to equality. We're using comparative legal approach. You saw our map of the different legal approaches. We're going to be modeling some possible policies and laws that could be adopted in countries to improve the outlook, to be more efficient in preventing genetic discrimination. It's also about open science and the power of networks. You will see that on this slide, and that from a rather small organization that was represented into maybe 4 to 6 jurisdictions, the GDO has really blossomed, and it's now represented in almost 30 different regions and jurisdictions, very well spread across the world, as you can see. I'm taking a second to thank 3 of the collaborators of the GDO that are in this room, Professor Shing Ho, Professor Muto, Kari Muto, and Calvin O, of course. I'm really grateful for their work. And the idea is basically, these are all expert in genomics, ethical and legal issues that have an interest in genetic discrimination, and you contribute at your pace and you get recognized for your contribution. And this is exactly what open science is about. And you can do great things with open science. This observatory has really grown over the years. Now, as the last part of my presentation, I just want to quickly talk about some of the accomplishment and the things that we did. Of course, we focused on developing prevention tools and also discussing, bringing the attention on the phenomenon of genomic discrimination, identifying areas that are the source of problems and where it is developing. There's been some really high-profile publication in Nature Genetics, Trends in Genetics, and the European Journal of Human Genetics, for example. We've collectively acted as expert consultant for governments that were interested in changing their laws. And those governments have included Australia, Singapore, Canada, United States, the Council of Europe, France, South Korea, as well as helping a number of professional organizations worldwide. There's been international standard to prevent genetic discrimination that have been developed. We started with an information document on what was genetic discrimination and what could be communicated to research participants and genomic researchers for them to develop materials that effectively address the problem from an international perspective. We developed information capsules to explain in different language and jurisdictions what genetic discrimination was about in lay language. So that was mostly for patients and participants. We also have a secure database where people located in 4 countries can report incidents of genetic discrimination they're the victim of. And why only in 4 countries? Well, we have to make sure that there are necessary ethical compliance mechanism in those countries, and that people are allowed to actually report, and that we can use this information securely before making it possible. But we want to make it possible in a growing number of jurisdiction to report cases of genetic discrimination. And we're developing model, we will be soon. We have right now a research program that's underway that was intended to use a Delphi survey to ask experts around the world about what kind of what kind of laws were the most efficient to actually prevent genetic discrimination, as well as other questions such as, well, what kind of accommodation for different cultural, regional contexts should be considered. So this is just a few elements of our work, and I would be very happy to talk more about the Genetic Discrimination Observatory or the Center of Genomics and Policy, and I just want to thank all the members of this organization. There's much more than what you see in the pictures, but they are all essential contributor to our success. Thank you.
Thank you so much, Professor Zhai. Thank you. Our next presenter will be joining us via Zoom. Some of you would have met Dr. Colin Mitchell. So he is the head of humanities at PHG Foundation. Of course, we're delighted to have a number of his colleagues physically with us. Colin is unable to join us because he has become a new dad. So wonderful reason to be absent, I think. So just to check if Colin is with us now.
I am here. I don't know if you can hear me, Calvin.
Yes, you're coming across clearly. We're just going to get a visual of you. Many congratulations again, Colin. I'm sure that this congratulatory message will be from all of us here. And of course, thank you so much for making time for us. Of course, Colin's going to talk to us on a very important development, more developments to follow in this space. So definitely extremely cutting edge and wonderful to get a policy perspective from PHG Foundation, which has recently published a policy document on the topic. So with this, Colin, the floor is yours. Welcome again.
Thank you so much, Calvin. That's incredibly kind. And yes, thank you for disclosing that I hope, have a good excuse not to be there in person. Okay, well, thank you very much again. And thanks to you, Professor Ho and Professor Leung, and all colleagues at the Centre for Medical Ethics and Law for allowing me to maintain this contribution virtually. It really is a shame not to be there in person and join so many esteemed delegates for what promises to be a really stimulating conference. But our colleagues from the PHG Foundation are present in person. So if any stimulating questions or thoughts arise from this presentation we can't take up in the time allotted, please do take it up with them or contact me directly. As you said, Calvin, this is a talk based on recent work at the PHG Foundation, focusing on a kind of a specific example of particular difficulties for the regulatory governance of an emerging and potentially very powerful technology in the form of synthetic data. I think it's important to say at the outset that the focus of this talk and our work is on the development and use of synthetic data for a broad range of health research or development and innovation purposes. But it is, I think, relevant to note that there is considerable activity already in the field of synthetic genetic or genomic data set development. And as Professor Zhai already alluded, the challenges in relation to data protection and genomic data are arguably simply heightened by the highly complex and multidimensional nature of genomic data. So I'm bearing in mind that I'm going to be making points which are generic to data or health data more generally, but the specific challenges for genomic data are arguably only increased. And just very briefly to note, because I hope many in attendance will be familiar with us at the PHG Foundation, but as was already mentioned, we are a policy unit based in Cambridge and part of the University of Cambridge. And that means we approach these issues at the slightly more applied level often. So we are looking specifically at the interaction between regulation and frequently genomic science in practice, but we also transcend genomics to other areas of innovative biomedical and related technologies. And inevitably, in the past 5 to 10 years, much of our work has focused on challenges in relation to data and the generation of genomic data and artificial intelligence. And that is background really to the piece of work which I will be reporting now. This was a specific commission from the Clinical Practice Research Data Link team based at the UK Medicines and Healthcare Products Regulatory Agency, MHRA, led by Dr. Pooja Miles, who have developed considerable expertise in the generation of synthetic data for a range of purposes, in particular to train in terms of science and to improve algorithms or machine learning workflows in the development of medical devices. And what they had experienced from both a practical perspective and by assessing the literature was considerable ambiguity about the regulatory status of synthetic data, and in particular whether or in what circumstances such data may be considered personal data within data protection law. And you know, from their perspective as data controllers and those generating synthetic data, this was causing considerable issues in terms of their best efforts to comply with the law and to understand what their obligations are. And I should just mention on that slide that I'm obviously only speaking briefly at the moment, but there is considerable additional detail in our report, which is freely available on our website. So please do check that out if you're able to. So just to begin really with synthetic data, what is meant by synthetic data? Well, there are many different potential formulations. The one that we go with here is based on the work at the CPRD, and it's a general way of describing synthetic data as artificial data that are designed to closely mimic the properties and relationships found in real-world source data. And in the context we're interested in here, the source data are largely patient health records or patient data of different forms. But within that broad umbrella, there are a myriad different methods that can be used to generate synthetic data, all the way from a kind of manual generation and manipulation based on expert knowledge, through to cutting edge and highly promising methods using advanced algorithms and AI-driven approaches. A key amongst them is the use of generative adversarial networks, or GANs. And this is where you have two submodels which work in combination to try and classify examples as either real or fake until it is difficult to distinguish between the two. And in terms of the synthetic data sets that are produced as a result, again, there is a broad spectrum. They may be partially synthetic, for example, where synthetic data are generated for filling gaps in data sets, or they may be fully synthetic, and they may be lower or higher in fidelity, or how closely the data match the underlying patterns and correlations. And I think one other element before I move on to the kind of bulk of this presentation to note is that there are actually many different reasons for generating synthetic data and many different use cases. In the context we were interested in, synthetic data were actually generated to fill gaps in data sets and generate data which were not otherwise readily available. They were not collected. And I think this is important because, as I will kind of move on to now, much of the hype around synthetic data in recent years, and there has been considerable hype in the field of AI development in particular, is relatively based on the prospect of sidestepping privacy or data protection issues through the use of synthetic as opposed to real world data. And I think it's important to note that that isn't always the main driver. But they are often presented as privacy enhancing methods that can be used. However, there are privacy threats also reported in the literature of a varying nature, which depend entirely on the methods used to develop the data and the form that it takes. But for example, there are studies which demonstrate that data sets may be attacked for membership inference or attribute inference, which is feasible regardless of the form of algorithm used to develop the data. But there are also, in terms of an arms race between de-identification and identification, there are a range of safeguards that can be applied. Key amongst these is differential privacy, which to a degree adds noise to the data. And this means that there are trade-offs with the utility potentially of the synthetic data that are produced. So this is the kind of framing of the issue. The key query for us is the extent to which the synthetic data generated using the commonly used methods at present may constitute personal data, i.e., to what extent they fall within the scope of data protection law. And data protection law here, I mean the EU's data protection law in the form of the GDPR, the General Data Protection Regulation, and the UK's currently closely aligned equivalent, although caveat for how long that will remain the case. I won't go into immense detail here, but personal data can fairly quickly be described as information relating to an identified or identifiable natural person, and this may be either directly or indirectly identifying. There are many bits of this definition which require unpacking and are broken down in myriad forms of case law and guidance. But I think the general point is that from a data controller's perspective, a risk-based and contextual assessment is required to determine whether an individual is identifiable from data, both at the time of the development of that data and as technology develops. And the general framing, again, of how you approach this risk assessment is a standard of reasonable likelihood. Are there means which are reasonably likely to be available to identify an individual from that data in combination with other available data? This is inherently a difficult and subjective question. At one end, you have identifiability. At the other end, you have anonymization. The standard in general across Europe and in the UK for anonymization is set very high, so that only a very minimal risk or practical impossibility of identification is likely to lead to data falling outside the scope of personal data. And if you apply this to synthetic data, what's the current situation? Well, in our work, we found no direct court judgment or judicial opinion on this question to date. We're at relatively early stages, I think, in terms of the potential assessment in courts. But data protection authorities around Europe and in the United Kingdom have begun to consider the issue. These are in more horizon scanning discussion documents than in sort of authoritative guidance, but currently the authorities are generally adopting the same approach, which is to view synthetic data as a privacy enhancing technology and demonstrating cautious optimism about the privacy benefits of synthetic data, but highlighting the evidence of potential threats that I mentioned earlier. The UK's regulator has potentially gone a little further in acknowledging that it may be feasible to generate non-personal synthetic data from personal data sets. So there is scope that this would lead to data which fall outside the scope of data protection law. But again, this is cautious, and there are reminders to carefully consider the identifiability of resulting data. And in terms of academic commentary, we're also at a relatively early stage. Most discussion follows the same approach, viewing synthetic data from a perspective of privacy enhancing technology. I think many of the legal academics highlight the extent to which synthetic data really pushes at the boundaries of data protection law and adds further challenge to the already contested aspects of data protection law at stake here, including the appropriate scope and role of the law in general as part of a wider landscape of regulation. there has been some early discussion, like there may be potential for an alternative approach to synthetic data based on some novel aspects which could differentiate it from other forms of anonymization. But this hasn't really been developed yet. I will touch on some of these potential queries though in a moment. So I think to summarize where we are, we discern what we call an orthodox approach to assessing the status of synthetic data. Now, this essentially begins with the prospect that if personal data are being used to generate synthetic data, i.e. patient records are being used, which may be coded or pseudonymized, but still within the scope of personal data, a conclusion that the output synthetic data will fall outside the scope of data protection law will only be reached if it can be shown to a very high degree of confidence that threats of identification or re-identification are minimal and well safeguarded. From a practical perspective, in terms of those developing synthetic data, the difficulty is that there's no single threshold for identifiability that can be used. There are some range of helpful guidance and best practice which are generic to the technology being used, and these should continue to be followed. The crucial question, again, from the kind of developer perspective, is whether the source or the training input data are personal data, and then if so, the extent to which privacy safeguards and mitigations are applied to the output data sets. So this is where we are. We're so far so sort of standard from a data protection point of view, but there are potential challenges with this approach. So while it maintains high standards for privacy and data protection, it's not without costs. One primary one is the tendency for this to lead to risk-averse decisions on the part of those generating synthetic data, which could reduce the utility of that data. So when you apply safeguards like differential privacy, you may reduce how useful or how high fidelity that data are. And also it's likely to limit the availability of the data so that data are not made available more widely and potentially more disclosive in that sense. Again, significant time and expertise would be required on the part of the developers to assess the identification risks of synthetic data and to apply relevant safeguards. And perhaps most problematically from my perspective, if synthetic data are treated as within the envelope of personal data, then a myriad further challenges arise in determining how the various obligations and rights contained in data protection law actually apply when it's very, very difficult to determine whether a synthetic data set relates to an actual living individual. So, for example, how does the principle of data accuracy and the concomitant right to rectification apply to synthetic data? How does the right to object apply? These are not trivial difficulties for data controllers and regulators. And we consider drawing together the sort of technical development of synthetic data and some of those challenges. We query the extent to which an alternative approach might be appropriate in certain circumstances. So one element to consider is whether there are technical reasons to adopt a different approach in law or guidance. It could be on the basis that some data synthesis techniques and models result in practice in almost negligible identification risks. It's also potentially questionable the extent to which models retain personal data once they have been fully developed. And does this in some ways break a chain of personal data processing that began with the personal data used to train a model? Is it better to see that the chain is broken and that to an extent that data are thrown away? And you view the output synthetic data as something different, not part of that chain any longer. Also, there's a more general question of whether a full application of data protection and other aspects of law and governance to the development and training of synthetic data models actually goes a really long way towards addressing any challenges and concerns that arise in synthetic data generation. And this includes a kind of thicker potential approach to data protection law, so applying principles of fairness, for example, to really scrutinise that the development of synthetic data is done lawfully and ethically. And there are some sort of more fundamental questions, I think, which touch on the boundaries of the law I mentioned earlier and the difficulty that synthetic data presents for this regulatory sphere. One is the nature of the sort of harms that should be addressed through data protection law. For example, should it be the case that if a person is coincidentally, i.e. almost entirely artificially recreated in a data set without having been part of the source data, is that a relevant harm or risk here for data protection law? Does the stretching of the scope of personal data to encompass all forms of synthetic data potentially overstretch data protection law and warp its functions? And are some of the harms that may be relevant, in particular those in relation to groups and profiling predictions, are they better addressed through other parts of a regulatory framework? We query the extent to which data protection law sort of being the only show in town in some jurisdictions means a great temptation is there to ensure that it envelopes synthetic data within its scope. And what might an alternative approach look like? Well, a bit like our questions, this is very, very tentative, but we've seen an example from the NHS Health Research Authority that they have almost reversed the presumption in relation to synthetic data. I think this is a little crude, but I think, is it possible to view some forms of synthetic data as non-personal data unless demonstrated otherwise? For data controllers and developers and regulators, there is no one-size-fits-all answer to the question of whether synthetic data are personal data. Everything depends on methods and context. There is currently clearly an orthodox approach that should be followed, but we think there are important reasons to consider an alternative. And for that reason, we think those developing synthetic data, researchers, regulators, and policymakers should try and work together to achieve greater clarity and consensus about both the appropriate standards and approaches that should be applied to specific technical measures at the moment, but also whether a different shift in presumption might be a more proportionate approach and the feasibility of implementing that in practice. I think more generally, in terms of the development of synthetic data and other forms of generative methodology and AI-driven processing, we need to think more broadly about the form of regulation that's appropriate for these technologies in the health context and how that fits within the overall regulatory framework. I'm going to leave it there. I'm very happy to take any questions. As I say, there are colleagues in the room too, if you would like to follow up at greater length in the future, or you can get in touch with me via my email. And I'll just thank everybody for their attention, and also to my co-author, Elizabeth Redrup-Hill, and the commissioners at the CPRD. And as other presenters have already said, we're also very grateful at the PhD Foundation to the Wing Foundation for their support in our very happy and successful collaborations with CMEL. Thank you.
Thank you so much, Colin. This is clearly a space to keep in view. Well, we hope to welcome you back to Hong Kong on another occasion. Thank you so much for taking the time to join us at this meeting, and we look forward to being in touch.
Thank you so much.
Join me again. Thank Colin. Yeah, thanks again, Colin. So following Dr. Mitchell's excellent presentation, we have another close friend of the Center for Medical Ethics and Law speaking to us, and that's Dr. Chi-Sing Ho. Xing has a long history with the center, and now a hugely accomplished scholar. So, well, we are very fortunate to get to hear her speak on an important topic, participatory governance. As you see that this particular theme will continue to the presentation of our next speaker, Dr. Momoko Sato. And then tomorrow, Professor Jane Kay, who has led us in many ways to think about the regulatory needs of this space. So with this, Dr. Ho, over to you. Thank you.
Okay. Yeah. Thank you so much, Calvin, for a very, very generous invitation and introduction as well. It's always my great honor and pleasure every time when I come back to Hong Kong, especially here in Hong Kong. Especially I would like to thank Wing Foundation, important people, Dr. Anthony is here and Anna is still sitting there. So it's really a great pleasure to be here. And today, the topic was actually assigned by Calvin. So I'm trying to see whether I can share a little bit about this participatory governance framework and experience we now developing in Taiwan. So I will use two important cases to introduce this concept. One is about the return of result currently with the Taiwan Precision Medicine Initiative. And the other is about the group consent. We've been using this group consent so long as the research involved with Taiwanese Aborigines. So just as previous speakers mentioned about this concept about participatory governance, it's never been a new concept, right? So we've been discussing this for a long, long time, especially every time we want to emphasize the importance to include participants in the research design and also along with the development of research. So we try this participatory governance and we try to give many justifications. And here I just list two, the most important justification. The one is that we want to build trust between researchers and participants, and also the social trust about how the research design. So we want to use this mechanism to have people to come in and to engage with the research. And the second one also we use very frequently in theoretical framework is about the fairness. So we try not only to see donors as participants, we try to treat them as stakeholders, so they can have their own voices to be heard in terms of this research design and also sharing of research result. So for theoretical justification, it seems to be very straightforward, but most challenging probably come to the how can we implement this principle and justification in reality. So here I'll focus more on the procedure design. And here we see there are many, many different kinds of procedure involved with different kinds of value. So for example, if we talk about the involvement, consultation, do we treat the participant equally as a researcher, or do we try to give more power to participants to respect their status? So we talk about collaboration, we talk about empowerment, all these things, all these different mechanisms, when they try to dialogue with the important justification, we need to try to distinguish different values, what kind of values this mechanism want to deliver. So here I just come to Taiwan's experience. The first one is about, it's very recent case, actually still developing. It's the Taiwan Precision Medicine Initiative. This big project was initiated, I think in 2019, probably 2019. And it's operated by Academia Sinica. It's my own institute. It's a National Research Institute in Taiwan, along with 16 medical hospitals around whole Taiwan, around whole country. So the purpose we want to use this initially we call the TPMI project. And the purpose is that we want to try to find the polygenic risk score, the PRA score, particularly suited for Taiwanese population. So we want to collect all original target is to collect 1 million, but because of some delay and some budget issues, so now we cut it half to 500, 500, sorry, 5 to 500, yeah, just half million, yes, half million. And now we've already finished all this sample collection. So we are now moving toward the second stage to do this genomic analyze, and also to do this genomic sequencing. But this project doesn't really involve with whole genome sequencing. We use panel to make this possible. And the purpose is that in the future, if we can find a particular PRA score, especially for Taiwanese population, and at the very beginning, we can sell these panels by the national insurance with a very reasonable cost. Then people can do some preventive action to make this health management possible. So even though the project called Taiwan Precision Medicine Initiative is more like a precision health management project. So the most important thing is that we try to establish a guideline. Light guideline will be a little bit different from what we have now. Like the guideline being developed focus only on the white people or other ethnics. So here we will develop our guideline and especially through the clinical practice use. So if we look at the Taiwan Precision Medicine Initiative, and there are two important goals. The first one is just what we mentioned about, it's about the report genetic testing result. So we, at the very beginning on the consent form, we already inform all the participants that they will receive the report about their genetics screening result. And there are lots of discussion about how much information we would like to share. And do we also need to have, like, for example, genetic counseling advice if we want to share this genetic information, especially because of the TPMI project is still a research project. So it hasn't really been completely transferred to the clinical setting. And the other thing, the other result is that we will automatically have this large genomic database. So how can we regulate this database turns to be very, very challenging issue. Especially at the very beginning, I mentioned about this TPMI project. It's a project-based specific consent. So it's also very different from the biobanking, the broad consent basis. Then now we have this a large database with a specific consent. And how can we use this data in the future into the secondary use of different purpose that creates lots of discussion nowadays. So why Taiwan want to do this? What's the advantage we have? I think one is that we want to focus on the pharmacogenomics. So we want to find a PRA score and genomic panel that is especially suited to Taiwanese population. And we have some data shows that, for example, in terms of lung cancer, the lung cancer for the Asian young women is probably 3 times compared to other ethnic groups. So there are lots of difference, and we need to find these particular high-risk groups, especially in Taiwan. Also, we want this data can be linked back to the national health insurance data and also clinical data now we collect here in Taiwan. And the other one is that we have this comprehensive national health insurance system in Taiwan. So it covers 99% population. So all these advantage, it makes Taiwan could be a good place to try this Taiwan precision medicine initiative. And also in terms of some potential, to use this research result, probably is not only focusing on Taiwan, it could target to the rest of the world in terms of the Chinese population. So here I try to distinguish a little bit about these two important projects. The Taiwan development starts quite early. It's about almost over 10 years now. So it's also operated by academic Sinica. But very, very different is on the consent model and the legal framework we base to operate these two big projects. Taiwan Biobank is a broad consent, so the purpose is quite simple. It just established a biobank and welcome every researchers within Taiwan to apply for on specific research project for biomedical research. But TPMI has very, very specific purpose. So now we still rely on the specific consent. So it comes to the issues is about the different legal framework we rely on. So for biobank, we have this specific law focusing on biobank regulation itself. I understand like not many jurisdictions use the specific law to govern biobank, but Taiwan does. So we have this Human Biobank Management Act, and now let's we have lots discussion about the revision of this particular specific law on biobank governance. And why this year have many discussions is that the government realized that the project like TPMI, it cannot really be governed based only on the Human Subject Research Act, and it probably cannot be governed only based on the specific consent. So how can we use the biobank model to govern retrospectively to a research project that's already going on? It creates lots discussions and problems. And in the future, now the TPMI project will also be governed by the Human Biobank Management Act. So we use this revision of the Human Biobank Management Act to deal with some reconsent issue. So we use the opt-out mechanism, and it will be stipulated quite clearly on the revision of the law, say like in the future, all the data being collected with specific consent within the TPMI will be transferred automatically to a biobank model. But if the participant doesn't really want their data to be transferred to biobank for the future on specific research, and they are entitled to opt-out. Also, the main difference is about the return of result. Because in Taiwan, the biobank is like a common good infrastructure, so it doesn't really involve return of result. Even though some researchers, they probably find it's possible to inform earlier to make this clinical action be possible. But based on the consent form, we already say quite clearly back to 10 years ago, say there's no return of result because we want the biobank to be a pure common good research resources. But for the TPMI, it states quite clearly on the possibility for return of result. So the way of return of result evolving with the TPMI is that we use this website, and 16 hospitals, they will design their, we have this common data model and common website, but they can still tailor a little bit on what kind of information they will be happy to share. And because of this flexibility, it also causes many issues. For example, some hospitals, they share more information to the participant, and some hospitals stick with a very limited information sharing. So later, we just redesigned a common sharing return of result platform. So here we can see the sharing of return of result is actually very preliminary stage. So participants, they are not expected to receive a very detailed information on what kind of risks they are involved. Here, we use the traffic light. Say, for example, whether this participant, they are carrier of particular variant, and if, for example, if they belong to the high-risk group, and now they see the report and they will be labeled as a red light. So that means that they will be encouraged to back to the hospital again to do a formal genetic testing. And while we try to use this very conservative way to do the return of result sharing, is that many challenges is about how can we try to distinguish about biomedical research and clinical application, and especially this pressure is from the government. The government always say the TPMI is still a research project, so it's not very happy to see much information to be released only by the research project because it involves with the liability issues, and probably these liability issues cannot really be solved at the very beginning on the consent form. So it also back to us that we have to state quite clearly about the limitation, especially on this risk prediction model. What kind of limitation that will involve with this PRA score? And also, we now try to put more emphasis on the role of genetic counseling. But it's very tricky in Taiwan is that in Taiwan, we doesn't really have a national certificate for a genetic counselor. So we still use like academic association to do this training and to make this genetic counselor to have some role to play. And here, especially in TPMI, it requires lots this education and training efforts to do this science dialogue and translation. And also, we've been discussed what can we do the return of result to be more responsible. So for example, which genome research results should be returned and how they are returned. The way they are returned is also very important because if we base on the website and probably we just include a particular person who are not very easy to use this electronic mechanism. And also, we've been discussed whether the researcher, they have this liability or obligation to provide updated information over time if there's a new information is learned. As we know, like the TPMI project is targeted to finish in 10 years, right? So we still have many years to go, and whether the researchers, they have this obligation to keep updated information. Only make this a very good idea of return of result probably be not easily to be implemented in reality. And the same situation come to the group consent. So here I share the group consent as an implementation problem as well. And in Taiwan, so long as the biomedical research involve Taiwanese origin, whether you target particular for Taiwanese origin or you just target for the Taiwanese population, but you by chance to collect data or samples from the Taiwanese origin. And we have some laws that makes the consent model is different, is that you cannot only based on the individual consent, you have to supplement with group consent. And land laws stipulated by the basic law of indigenous people. It's like a constitutional law level, and also the Human Subject Research Act. So the challenge of implementation is that very traditional challenge is that if we talk about the collective or group consent and what does the group means and who can be the representative of that group. And here from the picture we can see if we use the term like Taiwanese origin in contrast with Han Chinese, and probably all the Taiwanese origin can be categorized as a whole group. But in reality is that we have actually now is 16 different tribes. And all these tribes, the classification is probably not only based on the genetic factors, most of them based on the culture, political culture classification. If we look at the custom and the language they use. So they share very different culture, even though they've been categorized broadly as Taiwanese origin. So back to the legal definition about these indigenous people in Taiwan, and we also see some very interesting points that it's actually an evolving definition. So that means not only on these 16 recognized tribes we've been called indigenous people in Taiwan, for other tribes, so long as we regard themselves as indigenous people, they can apply to get approval from the Central Indigenous Authority. So it's application approval basis. And all these requirement has been criticized heavily by the Taiwanese Aboriginal people because they always emphasize that it's their own self-determination and self-recognition. Only self-recognition should not really be involved with this political recognition. So long as they feel themselves as Aboriginal, their recognition should be respected even without formal application, but still the law requires the formal application. And also, in terms of the definition of tribe, it's also very interesting because the definition of tribe is mainly based on this cultural political classification. We look at the area they live and the traditional norms they follow. So each of the group now they have their distinct language, customs, social culture, and cultural feature. But interesting is that all these traditional norms back to this modern society, they could be changing, they could be evolving as well. So they also have lots of concern for Aboriginal people concerned about the stigmatization. Because in terms of the whole population in Taiwan, we only have 2% people, the percentage people they call it Taiwanese population. So compared with the Han Chinese, in terms of the genetic research, they are very easy to single out this particular group. So there are lots discussion about the stigmatization. And one way we introduce group consent is trying to ease this kind of concern, especially in genomic research. So nowadays, we try to have, based on the legal requirement from the Human Subject Research Act, we try to have this compulsory consultation process that need to be obtained right before the consent of the Aboriginal group. And also all this consultation also involve with the publication of research result. So it's not only at the very beginning of recruitment, it will also be following the development of the research until the publication of research result. And in 2016, the Central Council of Aboriginal People, they just stipulate the implementing measures on consultation. So even though we have these group consent ideas very early, it hasn't really been implemented very well until 2016. Now we have these implementing measures. And back to the measures, it lists some compulsory contents for group consultation. For example, so long as like biomedical research involved with commercial interests, there is a compulsory benefit sharing requirement that we enact with the Human Biobank Management Act in Taiwan. So the benefit sharing is a compulsory content for group consultation. And the other one is about the recruitment process, focusing on this target population participation, and also about the technology transfer. It will also be at the very beginning, even before the consent was obtained, it will be put into this group consultation process. So still, the main issue is about the implementation. So we are back to look at implementation challenge. And in this implementation matrix, we categorize 3 different levels of group consultation mechanism from the central level to the local level. So we rely on this central advisory council to be the most general group consultation mechanism, and also they can be lowered down to the district advisory council or particular for the tribal council, depends on the researcher's application. So researchers, they will do their own judgment at the very beginning to see how large the scope involved with Aboriginal people based on their research design. If their research design, for example, target not only specific tribe, but Taiwanese Aborigine in general, that on their application form, they will take the proper the group consultation mechanism. They will go back used to the Central Advisory Council. But in the end, it's still the Council of Indigenous Peoples discretion. They have discretion to decide which level of group consultation that will suit this particular research project. So here comes the challenges that, as we mentioned about this traditional social structure that we use for this group consent. For example, back to the tribe culture, they have their representation, they have their way to show their representation. And now because of this culture change, we probably cannot respect so much on these traditional norms that have been practiced by the Aboriginal people. We still use this very modern political administrative design to do this group consent implementation. So that makes the concept of group and community, especially in the Taiwanese operational concept, fluid and porous. And other things is about the challenging process, because we mentioned about all these consultation need to be finished right before the consent the consent process really start. So that make lots burden to researcher. And the side effect is that now many researchers they try to skip not trying to study Taiwanese origin, and even though they target Taiwanese people in general, they still very cautious and very careful not to collect data or sample by incidentally from Taiwanese Aboriginal people. So it makes us to rethink about all this procedure design. Even though we found the value of the justification of participatory governance is very good, very high. But in terms of its implementation, it makes the Taiwanese Aboriginal people nowadays in biomedical research turn to be a missing group. So it's definitely not the result we will be happy to see, and it's outside of our expectation. So back to my conclusion, I think we try to use this case to try to say two things. One is that there are still many challenges in terms of this participatory governance, especially on the procedure design, probably not on the justification itself. So nowadays we see there's a trend of moving from benefit sharing to power sharing. So we always try to use this concept about empowerment, about this treating participant as our stakeholder. But still, we have to look at this implementation mechanism. For example, in terms of return of result, do we really share power with participants, or we just share data but try to formally to look like they are our stakeholder? And with this one-way sharing of data, they could really empower participants, or they will probably bring other kind of controversial issues, especially for the genomic study, and we are still waiting to see. And also for the group consent case, we also see this inclusive and exclusive result. We hope this mechanism to help us to include Taiwanese Aborigine into all this biomedical research design. But in the end, actually, we put the Taiwanese Aborigine to be outside of all the biomedical research initiative in Taiwan, because all this burden for the procedure implementation, so make them turn to be a missing group. So here I would like to say there's very important to reconnecting this procedure design back to the justification. We have to rethink about what kind of value that we want to preserve. So for example, if we talk about engagement, empowerment, stakeholder, what kind of value we want to preserve to use this kind of procedure. And we have to back and forth to check whether this procedure design, whether really help us to preserve this value and not to turn the other way wrong. So I think I'll use these two cases to help us to rethink about the principle of participatory governance. And thank you for your attention. I look forward to more discussion with you all. Thank you.
Thank you so much, Professor, for the wonderful insights, particularly at a time when we're thinking of how to diversify genetic data sets. But we're going to continue on this theme very quickly, now looking at Japan. So our colleague from Japan, Dr. Momoko Sato, will be speaking to us on related concerns. And then, of course, on the third day, we'll hear from Professor Muto as well. But for now, we'll think be wonderful insights to understand the situation in Japan, particularly when the general impression of Japan is that it's extremely homogeneous, or perhaps not. So with this, Dr. Sato, over to you. Welcome.
Good evening, everyone. I am Momoko Sato. Thank you very much for this opportunity. My presentation title is Indigenous Research Ethics Governance in Japan and its Implications for Genomics. I work for RIKEN, the Center for Integrative Medical Sciences. RIKEN is a research institution in Japan, and I am a PhD student at the University of Tokyo. So, first, I would like to clarify that I have translated most Japanese names and quoted sentences from Japanese to English, so these may be inaccurate and official English translations may be available in the future. I have no COI to disclose, but my supervisor, Professor Kaorimoto, is attending a meeting to establish ethical guidelines for research on Ainu people, which I will introduce later. So, let me start by giving a brief overview of Ainu people in Japan. This map is from the Cabinet of Secretariat at the Japanese government, which is in charge of Ainu policy. Ainu people used to live in northern part of Japanese archipelago, particularly in Hokkaido, shown in red on the map. And in the late 19th century, Japanese government occupied this area, and since then, Ainu people have been assimilated to Japanese culture and language. So their traditional lifestyle has not been well conserved as a result of long-term assimilation and discrimination. In addition, the Japanese family registration system, which records nationality, does not distinguish Ainu people. Therefore, an identity confirmation system is lacking. These photos are from Nibutani Ainu Culture Museum, and this is a photo of a traditional small knife for women called menoko makiri. And this is a photo of restored Chise village, Ainu style of construction. So regarding research on Ainu people, the excavation of Ainu graves for research purposes, especially anthropological research, has been continued since the late 19th century, and it has been the core of the discussion. In particular, whether these human remains can be used for research purposes or not has long been debated. So, this is a photo of an article of a newspaper about reburial of Ainu human remains repatriated from the City Museum and the Sapporo Medical University in 2019. And the law concerning Ainu people mainly focuses on cultural promotion, and it does not refer to research ethics. And furthermore, Japanese research ethics regulations, including laws, acts, and guidelines, do not specifically address research on ethnic minorities. To address this issue, the Ainu Association of Hokkaido, the largest organization of Ainu people, and 3 academic societies, the Anthropological Society of Nippon, Japanese Archaeological Association, and the Japanese Society of Cultural Anthropology, drafted ethical guidelines for research on Ainu people. This was released in 2020, but it has not yet been finalized. By the way, although the Ainu Association of Hokkaido is the largest group of Ainu people, it is not a representative organization because its membership is voluntary and it does not it only covers Ainu people living in Hokkaido Prefecture. So the representation and group definition problem, which Dr. Ho referred to, is appears here too in a little bit different structure. And The guidelines aim to regulate research on Ainu people and their history, culture, and society in Japan by researchers belonging to these 3 academic societies. And the guidelines also establishes the regulations on the Research Ethics Committee specialized in research on Ainu people. However, as these guidelines are voluntary, it do not have binding force. So, I would like to introduce one point in the discussion leading up to the development of these guidelines, the dissemination of research results. This concept emerged as a condition for Ainu research. Basically, Ainu human remains collected in past excavation should no longer be used for research purposes. However, since the early period of discussions, one of the provisions for research on human remains was the dissemination of research results. These are statements about the dissemination of research results, as the official records do not indicate the source of the codes. We cannot assume that they really represent the opinions of Ainu people. Still, they provide some clues about attitude toward dissemination of results. Regarding the issue of human remains, we would like to request both dignified memorialization and the dissemination of research findings. If the roots of the Ainu and their past living conditions were clarified through the research, I believe they would lead to the elimination of discrimination and prejudice. Research findings from human remains through archaeological excavations and so on can be a testament to indigenousness. Through these discussions, the dissemination of results was conceptualized as a practices similar to public relations. It was agreed that research results should be disseminated through museum exhibitions and so on. And in the 2011, a working group at the Cabinet Secretariat concluded that Ainu human remains can be used for research to elucidate Ainu history with the acknowledgement of Ainu people. So, legal regulations in Taiwan provide another perspective. Dr. Ho already gave us a very informative presentation about this point, so I don't repeat everything. But the Indigenous Peoples Basic Law and its measures stipulates that the same procedures of consultation and consent used at the beginning of the research applies to the publication of results. In order to promote the notion of dissemination of results, such engagement can also be practiced in Japan. So I would like to move on to the relationship between the draft guidelines and recent genomic technologies. In this summer, a comparative genomic analysis on human remains from the Catoctin Furnace, Maryland in the United States, and the 23andMe customers revealed that living descendants of Catoctin Furnace laborers exist across the United States. This was a novel approach because it directly compared the ancient and current DNA. Few records exist of the legacy and lives of African American workers and their families, but this analysis offers clues about the workers' lives. Although this is a promising new method to detect ancestry, it is ethically difficult to convey such results to the DTC testing customers because the customers consented on research use with their data anonymized, so results are not supposed to be returned individually in this case. Although people in Japan are considered relatively genetically homogeneous, several companies offer direct-to-consumer ancestry testing. For example, GenLife's Haplo 3.0 claims that it is a service to offer a personalized genetic test kit to identify your ancestral roots based on your DNA. and DNA's microcode offers characterized category of ancestry, such as people of rice cultivation and the oldest inhabitants in Japan, and so on. These types of testing is commonly utilized by YouTubers in Japan, so maybe some viewers are encouraged to try the testing. These tests seem to use maternal or sometimes also paternal haplotypes to detect customers' ancestry. To the best of my knowledge, available test kits do not provide Ainu ancestry as a result, so they are not designed to detect Ainu ancestry. This can be interpreted as an example of ignoring Ainu people. However, the reason for this gap in ancestry testing requires further consideration. Turning to the academic field, many genomic studies, especially studies in population genetics, have focused on Ainu people. These publications were published in international journals in genetics and anthropology, such as the Journal of Human Genetics and Genetics. Many of them do not involve the collection of new samples from Ainu people, but use existing data from previous research. The draft guidelines may not be applicable to these studies. Although the draft guidelines require approval from the Ethics Committee for Research on Ainu people, including anthropological, biological, or medical studies, they only apply to researchers in the academic societies. Furthermore, scientists in the fields of health, medicine, and genomics are not involved in the discussions leading to the establishment of the guidelines. Anthropological, archaeological, and genomic studies share many of the same issues when focusing on Ainu people. Still, several issues are particularly relevant to genomic research. I would like to focus on 3 points. First, some genomic or genetic research is based on samples of Ainu people obtained decades ago. The draft guidelines stipulate that for secondary research, it is required to consult with related Ainu individuals and communities to obtain consent again. However, if genomic researchers adopt these guidelines, how far should this policy be retrospectively applied? If it is applied to data acquired 40 or 50 years ago, is it feasible to identify individuals or communities to consult with? Even if living family members are identified, they may not be aware that their family provided samples which have been used for research for decades. It is also not clear who will lead the communication, particularly as such data may already freely accessible from all over the world. Second, large-scale genomics research focused on the whole Japanese archipelago can unintentionally include samples from Ainu people because in most cases, this group is not distinguished from other Japanese people during recruitment. In this case, naming clusters or parameters associated with the Ainu is a sensitive issue. So, such a cluster may include individuals who do not identify themselves as Ainu people, and alternatively, such cluster can exclude individuals who do identify themselves as Ainu people. And furthermore, studies that are not primarily focused on Ainu people are not covered by the ethical guidelines. Even if researchers are aware of these issues, it may be difficult for them to refer to the guidelines proactively. Finally, racial discrimination should always be considered. If remarkable genetic differences are found between Ainu people and other Japanese population, What can scientists do to avoid racial discrimination and stigmatization? A more troubling issue may arise if differences are not detected in a particular study. Ainu people have experienced discrimination for a long period. Even now, the concept that Ainu people no longer exist as a result of assimilation is typical in discriminative discourses. For example, in 2014, a member of the Hokkaido Prefectural Assembly was condemned by stating that it is highly questionable that Ainu people are indigenous. The scientific publication of studies reporting similarities between Ainu people and other Japanese population may lead to harsher discrimination. To conclude, the discussion about research ethics related to ethnic minorities in Japan has just started, and emerging genomic or genetic technologies enable further ancestry analysis. And these tests are gradually becoming popular in Japan. However, the inclusion of genomic researchers in discussions of ethics regulations on ethnic minorities is not sufficient right now. Therefore, it is important to understand the opinions and norms of researchers in genomics in Japan. I would like to conduct further research in my doctoral thesis. So, last, in this presentation, I focused on research ethics guidelines for Ainu people because it is currently being established. However, these issues can be applied to other groups that experience discrimination and stigmatization in the past, such as survivors of the atomic bombs and their descendants. So these are main references used for this presentation. And thank you very much for your attention. This beautiful place is a memorial site at the Upapoi National Ainu Museum and Park in Hokkaido. The building on the left houses Ainu human remains that have not yet been repatriated to the local communities. Thank you very much.
Thank you so much, Dr. Sato, for a very insightful and engaging presentation. We see that a lot of the conventional issues haven't quite left us, whether it's about vulnerability or in terms of thinking about biobanks, more conventional issues, specimens from deceased individuals, so all of which remains very important food for thought.